Subcommittee will come to order, and I'll recognize myself 5 minutes for an opening statement. And good morning to all. Today we convene to mark up 5 important bills that will strengthen our public health workforce and protect our country from potential biological threats. Some of these bills will equip our healthcare system with the tools to maintain a robust, well-educated workforce, while the Pandemic and All Hazards Preparedness Act reauthorization bill will provide a framework for our emergency preparedness infrastructure to plan for threats such as disease outbreaks. As a physician, I've always supported programs that improve access to care and enhance the patient experience, and the bills before us today seek to accomplish that goal. First, we're considering draft legislation to reauthorize the Pandemic All Hazards Preparedness Act from the bioterrorism threats after 9/11 to more recent public health threats to our nation, such as Zika and H3N2 influenza virus. Our partners at the federal, state, and local levels must have the necessary tools and resources to quickly and effectively respond when disaster strikes. To bolster their efforts, I would also like to see the Mission Zero Act, which was passed out of this committee, and language to improve the technological infrastructure of the BioWatch program included in the Pandemic Hazards All Preparedness reauthorization. Mission Zero has already passed the House earlier this year with strong bipartisan support, and I expect we can reach a bipartisan consensus on both initiatives prior to the legislation's markup at the full committee. This Pandemic All Hazards Preparedness Act reauthorization is critical in protecting the lives of all Americans. Again, I want to thank Representatives Susan Brooks and Anna Eshoo for their work and the work of their staff on the draft legislation before us today. And I want to thank Ranking Members Green and Pallone and their staffs for working in such a bipartisan manner to keep this important reauthorization moving forward. Next, we will consider bills that reauthorize the physician workforce programs under Title VII and the nursing workforce programs under Title VIII of the Public Health Service Act. Each of these programs seeks to increase access to providers in underserved areas and promote the training opportunities for medical students and providers to maintain their skills. H.R. 3728, the Educating Medical Professionals and Optimizing Workforce Efficiency Readiness Act, which I introduced with Representatives Schakowsky and Bouchon last year, and H.R. 959, the Title VIII Nursing Workforce Reauthorization Act, introduced by Representative Joyce, will reauthorize these important programs, both of which have expired. While Congress has appropriated funding for these programs in the past, it is essential to reauthorize and ensure longer-term stability, particularly for the future generations of providers. Our medical professionals need to be adequately trained to manage patients with serious illness who are seeking either palliative or hospice care. H.R. 1676, the Palliative Care and Hospice Education and Training Act, written by Representative Engel and co-sponsored by many members on this committee, helps build our palliative and hospice care workforce by establishing and supporting palliative care and hospice education centers through federal grants while enhancing research in palliative care at the National Institute of Health. Lastly, the subcommittee will consider H.R. 5385, the Children's Hospital Graduate Medical Education Support Reauthorization Act, which Ranking Member Green authored. This important legislation reauthorizes payments to Children's Hospital Graduate Medical Education programs for another 5 years so that our nation's children's hospitals can continue to provide education to medical school graduates and enhance pediatric research capabilities. Children in Texas and across the country will benefit from the financial support provided by this bill, ensuring physicians have the preparation and training for the complex reality they will face in their careers as pediatricians. I want to thank all the members and the staff. A lot of people put hard work into these bills and certainly look forward to advancing them out of this subcommittee to the full committee. And I now recognize the gentleman from Texas, Mr. Green, for 3 minutes for an opening statement.
Thank you, Mr. Chairman, for holding today's subcommittee markup on 5 public health bills, including the Pandemic and All Hazards Preparedness and Reauthorization Act and the Children's Hospital GME Supports Reauthorization Act that we introduced in March. I'm proud to have introduced the Children's Hospital GMA Support Reauthorization Act with the chairman of our subcommittee, Dr. Burgess. We heard from medical experts from Texas, California last month, including the vice chair of pediatrics at Texas Children's Hospital in Houston, on the importance of reauthorizing the CHGME program. The CHGME program provides needed funding to train our nation's pediatric workforce, including pediatricians and pediatric subspecialists, which are greatly needed in many communities around the country. The CHGME program is necessary due to how federal support for GME is currently structured, compensating hospitals through the percentage of Medicare patients they provide care to. This formula puts freestanding children's hospitals at a clear disadvantage. Our legislation will reauthorize CHGME program for 5 years with an 8 to 10% funding increase. As of today, our bipartisan legislation has 61 co-sponsors, and I think I have 3 more to turn in today, Mr. Chairman, including many members of our committee, and has a strong support from the outside stakeholders, including American Hospital Association and the Texas Children's Hospital Association. I thank the chair for including the Children's Hospital GME Support Reauthorization Act in today's markup, and I'm looking forward to the bill clearing the full committee and its consideration before the entire House. PAHPA is an important law that provides Department of Health and Human Services with the reauthorizations and the resources necessary to help American people during emergency or pandemic. I'm happy to see the progress that PAHPA reauthorization has taken since our legislative hearing 3 weeks ago. In particular, I'm happy to see that the proposed transfer of the Strategic National Stockpile to ASPR would not be codified, instead would work in coordination with CDC. I plan to supporting the manager's amendment and ask all my colleagues to vote in support of that. Before I conclude, I need to bring up an issue of child separations, which is jurisdiction of Health and Human Services and, of course, our subcommittee. I disagree with President Trump's zero tolerance policy and the administration's decision to separate children from their parents in the strongest terms. It was inhumane and not reflective of our nation's history and traditions. While the Trump administration has reversed its child separation policy, there's still 2,000 children in the custody of the Office of Refugee Resettlement as a result. As a committee of jurisdiction, it is our responsibility to ensure that these children are being properly cared for, as we would want our children to be cared for, and to hear from HHS in an oversight hearing as soon as possible, as feasibly possible, on what is being done to protect these children and how it intends to reunite with their parents. One of the other things, Mr. Chairman, I think anywhere a member of Congress needs to look at where federal funding is being spent, and I know 2 senators from Virginia, members from Texas were refused admittance into facilities even with permission to request, and I think we need to look at legislation that would make sure that the Congress has the ability to see what's federal spending, whether it's in this case or any other cases. And I thank the chairman again for holding today's markup, and I yield the remainder of my time.
Gentleman yields back. Chair now recognizes the gentleman from Oregon, the chairman of the full committee, Mr. Walden, for 3 minutes.
Thank you, Mr. Chairman. Today, the subcommittee continues its important work on several pieces of legislation that are bipartisan and also vital to the public health of the nation. First, we'll consider the discussion draft to reauthorize the Pandemic and All Hazards Preparedness Act, known as PAHPA. It's been examined during a legislative hearing earlier this month. PAHPA enables critical partnerships between the federal government, state and local authorities, and the private sector to ensure our nation is responsibly prepared for and able to respond to public health emergencies. It is important that we get this right and that we reauthorize this program in a timely manner. As we continue to move through this process, I really want to thank and commend both our colleagues, Susan Brooks and Anna Eshue, who took the lead on this for their hard work on this reauthorization. Between today's markup and the full committee markup, we will continue to work with members on a bipartisan basis to incorporate their policy priorities and ensure we continue bipartisan support for this very, very important reauthorization. Those of us who have been in the classified setting and the briefings understand we need to get this done and not mess around with it. Today, we'll also consider 4 important bills that strengthen the federal government's longstanding investment in the education and training of healthcare professionals. First, H.R. 959. The Title VIII Nursing Workforce Reauthorization Act, that's sponsored by our colleague from Ohio, Representative David Joyce. This bill reauthorizes nursing education workforce development programs that are critical to the recruitment, retention, and advanced education of skilled nursing professionals throughout the country. Next, H.R. 3728. This is the Empower Act of 2017, which will reauthorize health professions workforce programs, including the reorganization of the Geriatric Health Professional Grant Program to reflect changes that the Health Resources and Services Administration has pursued to improve outcomes for geriatric patients. I want to thank our E&C colleagues, Health Subcommittee Chair Michael Burgess and Representative Schakowsky for leading the work on this very important initiative. We'll also consider H.R. 1676, the Palliative Care and Hospice Education and Training Act, sponsored by our colleague Elliot Engel. It's a cause that's near and dear to my heart and one that I've co-sponsored in prior years before becoming chairman. So I'm glad to see that it's moving before the committee today. This legislation will authorize the Department of Health and Human Services to award grants or contracts for palliative care and hospice education centers, promote the career development of nurses and physicians in palliative care, and promote research and outreach in the delivery of care for patients with serious or life-threatening illnesses. I've heard about this bill's impact from palliative care specialists and disease advocates from Oregon, including Don Frazier in Bend, Oregon, whose daughter Rhonda tragically passed away at the age of 34 after suffering from an early onset Alzheimer's. I'd like to submit for the record, Mr. Chairman, a Bend Bulletin opinion piece that Don wrote about this bill and have that entered into the record.
Without objection, so
Finally, we'll consider H.R. 5385, the Children's Hospital GME Support Reauthorization Act of 2018, authored by Health Subcommittee Ranking Member Gene Green, Subcommittee Chairman Mike Burgess. H.R. 5385 will reauthorize federal funding for graduate medical education at our nation's freestanding children's hospitals, building a pediatric health workforce to help ensure that every child has access to quality care. These are all really important pieces of legislation in the spirit of bipartisanship and working together for the good of the country that the Energy and Commerce Committee does. So we look forward to good markup here today. Glad we could work these things out, and I yield back the balance of my time.
Chair, thanks the gentleman. Gentleman yields back. Chair recognizes the gentleman from New Jersey. 3 minutes for the purpose of an opening statement.
Thank you, Mr. Chairman. Today we're considering 5 bipartisan public health bills. Taken together, these bills will strengthen our nation's emergency preparedness and response efforts and improve our health workforce. I thank the sponsors for the work they've done to date to move on these important bills. First, H.R. 959, the Title VIII Nursing Workforce Reauthorization Act, introduced by Representative Joyce and Matsui, would strengthen our nursing workforce by reauthorizing several programs that support the recruitment, training, and retention of nursing professionals. And I'm pleased to support this much-needed legislation. Next is H.R. 1676, the Palliative Care and Hospice Education and Training Act, introduced by Representatives Engel, Reed, and Carter, would improve education, training, and research into palliative care and hospice care. These are essential services that help individuals battling complex conditions to better manage their illnesses and to become as comfortable as possible at the end of life. This legislation will help ensure that we have the workforce to meet the growing need for hospice and palliative care, and I urge its passage. And then we have H.R. 3728, the Educating Medical Professionals and Optimizing Workforce Efficiency and Readiness, or Empower Act, introduced by Representative Burgess, Schakowsky, and Bouchon, would reauthorize programs funded under Title VII of the Public Health Service Act. Investment in these programs helps ensure that we have an adequate supply of healthcare providers. The bill would also boost training for geriatric providers who are increasingly in demand across the country, and I'd like to especially thank Representative Schakowsky for championing this issue. H.R. 3585, the Children's Hospital GME Support Reauthorization Act, introduced by the subcommittee chair and the ranking member, would reauthorize the CHGME program and importantly increase its authorization level. This will allow children's hospitals to bolster their graduate medical education training and ultimately to address shortages of pediatric providers. This program is critical to ensure that every child has access to the care they need, and I strongly support passage. And finally, I'm pleased that we're considering a discussion draft of the Pandemic and All Hazards Preparedness Reauthorization Act, authored by my colleagues, Representative Brooks and Eshoo. This legislation supports critical programs that are the foundation of our nation's emergency preparedness and response. During our hearing, I raised a number of concerns, particularly related to the codification of the administration's decision to move control of the Strategic National Stockpile from CDC to ASPR. And I'm glad that my primary concerns are addressed in the manager's amendment. However, I did want to emphasize that the draft we're considering today is far from a finished product. There are still many important outstanding priorities that I believe should be considered, and I'm committed to working between now and the full committee to ensure all remaining non-controversial bipartisan priorities are included. And I thank you, Mr. Chairman, and yield back.
Chair thanks the gentleman. Gentleman yields back. Chair recognizes the gentleman from Michigan for 1 minute.
Well, thank you, Mr. Chairman. This is an important day. The Pandemic and All Hazards Preparedness Reauthorization Act is certainly critical in keeping our citizens safe from dangerous public health hazards, whether they be natural or man-made. And I'm also pleased that we're marking up the Palliative Care and Hospice Education Training Act, legislation that I've co-sponsored. This is going to remove some of the barriers to patients' access to care that exists today. But the Children's Hospital's graduate medical education was always a priority for me when I was chairman of the full committee, and it's great to see that attention to this important program continue on a bipartisan basis. Children's GME is truly the pediatric training engine for Michigan and across the country and critical for providing essential care. I'd like to point out a very special guest from Michigan sitting on the end. Claire Wyckoff is 10, wonderful young woman. When she was 10, she was diagnosed with a ruptured arteriovenous malformation of the cervical spine. She gets treatment now from 3 specialists at Children's Hospital of Michigan, and this GME program is vital to her and children like her getting the care that they deserve. I yield back. Thank you for being here.
The chair thanks the gentleman. Gentleman yields back. And the chair would recognize the gentlelady from California, Ms. Eshu, for 1 minute.
Thank you, Mr. Chairman, for holding this markup on these 5 bipartisan bills. I'm proud to co-sponsor 3 of them. I support all of them. And I'm especially proud to have been the original author of PAHPA and to have worked in this Congress with a superb colleague, Susan Brooks, to reauthorize this legislation. The discussion draft that we're marking up today reauthorizes PAHPA, and we all need to understand that this is still a work in progress. There are many member priorities and stakeholder proposals still to be incorporated, and I think it's critical for us to reauthorize this legislation before it expires on September 30th. I will continue to work closely with Representative Brooks and certainly with Chairman Walden and our ranking member to finalize the legislation. PAHPA is especially timely because it authorizes ASPR, and on last Friday, HHS announced the creation of an unaccompanied children reunification task force to respond to the crisis the Trump administration has created at the southern border, that it's going to be run by ASPR. And so I think that this committee really needs to be prepared and to do oversight relative to how ASPR, because it is within our jurisdiction, how the needs of the families and the children are being met. So with that, Mr. Chairman, thank you again for holding this important markup. These are important bills, and I especially want to salute my partner and wonderful colleague, Susan Brooks, for the enormous amount of time and thoughtfulness that's been put into the process so far. I yield back.
Chair thanks the gentlelady. Gentlelady yields back. Chair recognizes the gentlelady from Tennessee for 1 minute for an opening statement, please.
Thank you, Mr. Chairman. I am so pleased to see the bipartisan bills to address provider shortages through Title VII and VIII, as well as the specialist shortages in the Children's Hospital GME program. Vanderbilt, St. Jude, Le Bonheur are all there in our part of Tennessee, and we know how vital this is to them. We've talked about the problems created by the shortages, but in medically underserved areas like much of my rural district in Tennessee, the shortages are acutely felt. Also, I'm pleased to see the reauthorization of PAHPA. The bill includes important features that will strengthen our ability to respond in times of emergency and disaster, and I look forward to the final version, including our Good Samaritan language. And I thank you for the hearing. I yield back my time.
Chair thanks the gentlelady. Gentlelady yields back. Chair recognizes the gentleman from Oregon, Mr. Schrader, for 1 minute. Does not recognize. The chair recognizes the gentlelady from Illinois, Ms. Schakowsky, for 1 minute.
Thank you, Mr. Chairman. I'm pleased that we're here today considering critical health workforce bills. I'm proud to lead H.R. 5728, the Empower Act, with Chairman Burgess. This bill is critical in ensuring that we have the workforce in place to respond to the needs of older Americans. Reauthorizing the Geriatric Workforce Enhancement Program and reestablishing the Geriatric Academic Career Awards will do just that. Not only are we currently facing a geriatric health workforce shortage, as baby boomers age, we will need more providers who are trained to respond to the unique needs of older Americans. Whether it is integrating geriatric care into primary care, giving family caregivers the tools they need to care for their loved ones with Alzheimer's, or expanding teaching centers to reach rural and underserved communities, the Empower Act brings us closer to building the healthcare workforce our seniors need and deserve. I yield back.
Chair, thanks, gentlelady. Gentlelady yields back. Chair recognizes the gentleman from New Jersey, Mr. Lance, for 1 minute for an opening statement. Does not recognize. Chair recognizes the gentlelady from Indiana, Ms. Brooks, for 1 minute for an opening statement.
Thank you, Mr. Chairman. Thank you for holding the subcommittee markup as we move forward with the reauthorization of PAHPA. I'm proud to be working on this important bill with my good friend, Representative Eshoo, who's been a leader in public health, a longtime leader. She was one of the first authors. She was the author of the first PAHPA bill in '06, as well as the lead author of the last reauthorization in 2013. And so it's critically important and I want to thank our staffs and all those involved for continuing to work toward making sure we get this reauthorized by the end of September. As we heard during testimony at the hearing and in the classified setting, we face threats around the globe. On May 8th of this year, the Democratic Republic of Congo declared an outbreak of Ebola. This is the country's 9th Ebola outbreak in 40 years, and while previous outbreaks have been in remote and isolated areas, this new outbreak is in a busy port city with more than 1 million inhabitants. On May 20th, India's government confirmed outbreak of the deadly Nipah virus. By the end of May, 19 cases of Nipah had been reported, 17 of which were fatal. The bill we're considering today creates a public health emergency response fund for the Secretary to use as a bridge when we face an outbreak like Ebola or Nipah, so that immediate funding is available, which we can then supplement with emergency appropriations bills. It also establishes a pandemic influenza program, as well as emerging infectious diseases program at BARDA to deal with known and unknown threats. PAHPA is a unique opportunity to examine our response to these threats. I look forward to continuing to work with all members of this committee and others on this bipartisan effort. I yield back.
Chair thanks the gentlelady. Gentlelady yields back. Chair recognizes the gentleman from New Mexico, Mr. Lujan, for 1 minute for the purpose of an opening statement.
Ben Ray, you're up.
Mrs. Castro. Is anyone on the Democratic side seeking time for an opening statement? Seeing none on the Republican side, Mr. Collins recognized for 1 minute.
Thank you, Mr. Chairman. I commend the efforts of this committee and Congresswoman Susan Brooks for spearheading the Pandemic and All Hazards Preparedness Reauthorization Act. In considering this legislation, I'd like to address a safety issue related to glass breakage, cracks, and particles in glass vials that may pose a threat to the drugs contained in the glass vials. Since December, the FDA has issued 5 glass recalls, and the agency has warned both healthcare providers and patients that glass particles and cracks can cause blood clots, sepsis, and other life-threatening events. As this relates to PAHPA reauthorization, this issue may affect the countermeasures currently in the stockpile. I feel it is important for those overseeing the stockpiles to be made aware of congressional interest in ensuring that safety measures are adhered to. And we need the FDA to conduct a study to quantify the status of the current stockpile as it relates to the integrity of the glass vials. I hope to work with the committee and Congresswoman Brooks on ensuring America has safe, secure, and sterile countermeasures. Thank you, and I yield back.
Chair thanks the gentleman. Gentleman yields back. Anyone remaining on the Democratic side that would seek time for an opening statement? Seeing none on the Republican side, anyone seeking time for an opening statement? Seeing none, the chair reminds members pursuant to committee rules, all members' opening statements will be made part of the record. The chair calls up H.R. 959 and asks the clerk to report.
H.R. 959, to amend Title VIII of the Public Health Service Act to extend advanced education nursing grants to support clinical nurse specialist programs and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. Chair recognizes himself to offer an amendment in the nature of the substitute. The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 959, offered by Mr. Burgess.
Without objection, the reading of the amendment is dispensed with. The chair recognizes himself for 5 minutes in support of the amendment. The Title VIII Nursing Workforce Reauthorization Act of 2018, introduced by Mr. Joyce of Ohio, reauthorizes the Title VIII Nursing Workforce programs for fiscal years 2019 through 2023. Similar to the Title VII programs, these nursing programs have expired but continue to receive appropriations. This legislation reauthorizes important programs that range from providing advanced practice nurses with additional educational opportunities to increasing nursing workforce diversity. The country is in the midst of a nursing shortage, and we must ensure that our healthcare system has the capacity to educate and retain a qualified workforce that allows for career advancement. This bill includes grants for nurses of different levels of education to obtain further education to advance within their profession. The amendment in the nature of the substitute simply changes the reauthorization levels to reflect the fiscal year 2018 omnibus and subsequent technical assistance from the Department of Health and Human Services. I urge my colleagues to support the amendment and yield back my time. Is there any other member seeking to speak on this amendment? Seeing none, the question then occurs on the amendment to H.R. 959. All in favor say aye. Aye. All opposed, no. Ayes appear to have it. The ayes have it, and the amendment is agreed to. Are there other amendments? If there is no further discussion, the vote occurs on. Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman, and Ranking Member Green for holding this markup on H.R. 959. This is so important. H.R. 959 would reauthorize vital nursing workforce development grants. In my hometown of Tampa, we're fortunate to have one of the preeminent colleges of nursing in the whole country at the University of South Florida. And I have visited numerous times, most recently in April. Specifically on that visit was to learn how they are treating our veterans. But every time I go, they tell me they're having to turn away prospective nursing students because they are struggling to find qualified nurse faculty to teach the nurses of tomorrow. And they emphasize how important Title VIII is, how it helps incentivize nurses to teach. One initiative in Title VIII is the Nurse Faculty Loan Program, which aims to increase the number of qualified nursing faculty to teach at accredited schools of nursing to help bolster the nursing workforce. The College of Nursing at USF told me that they have 15 nurse graduates that have just completed the Nurse Faculty Loan Program. So getting more nurse faculty in the pipeline and out to schools of nursing will help high-growth states like Florida and all of us who are in desperate need of a robust nursing workforce. The dean at the USF College of Nursing, Victoria Rich, says that by 2025, Florida will be short by about 56,000 registered nurses. So it's vital that Title VIII is reauthorized to ensure that we have qualified nurses to fill that gap and to care for our families. So thank you again, Mr. Chairman and Ranking Member Green, for holding this subcommittee markup, and I hope that H.R. 959 can quickly make its way through the committee and onto the House floor. I yield back my time.
Gentlelady yields back, Chair. Thanks, Gentlelady. The question now occurs on forwarding H.R. 959 as amended to the full committee. All those in favor say aye. Aye. All those opposed, no. Ayes appear to have it. The ayes have it, and the bill is agreed to. The chair now calls up H.R. 1676 and asks the clerk to report.
H.R. 1676, to amend the Public Health Service Act to increase the number of permanent faculty in palliative care at accredited allopathic and osteopathic medical schools, nursing schools, social work schools, and other programs, including physician assistant education programs to promote education and research in palliative care and hospice, and to support the development of faculty careers in academic palliative medicine.
Without objection, the first reading of the bill is dispensed with, and the bill is open for amendment at any point, so ordered. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? For what purposes the gentleman from Texas seek recognition?
Mr. Chairman, I have an amendment in the nature of a substitute for H.R. 1676.
The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 1676, offered by Mr. Green.
Without objection, the reading of the amendment is dispensed with, and Mr. Green is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. The amendment I have is actually Congressman Elliot Ingalls' amendment. He was detained in his district in New York. He was one of our survivors in the primaries that we had. But I want to thank my colleague, Congressman Ingalls, for his hard work on the legislation. I want to also thank the co-sponsors, Representative Buddy Carter of Georgia and Representative Tom Reed of New York, for their work and support of this important legislation. This is a bipartisan amendment making technical edits and adjusts the authorization level and modifies the text to ensure that funding is not diverted from current priorities. Palliative care complements efforts to treat or cure illness by focusing on patients' quality of life. It's appropriate for patients with serious illness starting at the point of diagnosis through treatment and on ward, through hospice, and in the end of life. Palliative care entails communication with patients, their families, to coordinate care, determine patient preferences, and assist with medical decision-making. A growing body of research has documented the benefits of high-quality palliative and hospice care for patients and families, hospitals and payers, and with the healthcare system as a whole. Excuse me, palliative and hospice care has been associated with enhanced quality of life for patients, reduced hospital expenditures, and lengths of stay and other positive outcomes, including longer patient survival time. Despite the benefits of palliative care, many Americans aren't aware of the supports available to them. There is also a shortage of educated providers who can offer quality palliative care. The Palliative Care and Hospice Education and Training Act aims to address these issues. The legislation will help create an infrastructure to improve palliative care training for health care providers, encourage NIH to expand its research on palliative care and pain management, and ensure Americans have an understanding of how palliative care may benefit them and their loved ones. I'm proud to be a co-sponsor of this legislation. In fact, the bill has 277 co-sponsors, nearly 2/3 of the entire House of Representatives. I urge my colleagues to support this amendment and the underlying bill, and I yield back my time.
Chair thanks the gentleman. Gentleman yields back. For what purposes the gentleman from Georgia seek recognition?
Move to strike last word, Mr. Chairman.
Gentleman is recognized for 5 minutes.
Mr. Chairman, I move to strike the last word. I'm proud to be an original co-sponsor on this bill that currently has more than 275 bipartisan co-sponsors. This legislation supports funding programs to provide clinical palliative medicine training in a variety of settings, including hospice, establishes a program to enable hospice and palliative physicians to train teams of interdisciplinary healthcare professionals in palliative and hospice care techniques, and expands the types of professionals trained to provide hospice care, including nurses and clinical social workers. Before my time in Congress, I served as a pharmacy consultant for hospice care. I've seen firsthand the impact that proper palliative care can have on patients and families going through incredibly difficult decisions at the end of their lives. This legislation ensures that there is a well-trained palliative care workforce available and ready for those individuals with serious illnesses. I want to thank you, Mr. Chairman, for holding this markup today and expanding options for our aging and seriously ill population. I thank you, and I yield back.
Chair thanks the gentleman. Gentleman yields back. Is there any other member that wishes to be heard on the Green amendment? Are there any other amendments to the amendment? If there is no further discussion, the vote occurs on the amendment in the nature of the substitute. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes appear to have it. The ayes have it. The amendment in the nature of a substitute is agreed to. The question now occurs on forwarding H.R. 1676 as amended to the full committee. All those in favor say aye. 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 All those opposed, no. The bill is agreed to and forwarded to the full committee. Chair calls up H.R. 3728 and asks the clerk to report.
H.R. 3728, to amend Title VII of the Public Health Service Act to reauthorize certain programs relating to the health professions workforce and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill is open for amendment at any point, so ordered, and I will recognize myself to offer an amendment in the nature of a substitute and ask the clerk to report.
Amendment in the nature of a substitute to H.R. 3728, offered by Mr. Burgess.
Without objection, the reading of the amendment is dispensed with, and Chair recognizes the chair for 5 minutes in support of the amendment. The Educating Medical Professionals and Optimizing Workforce Efficiency and Readiness Act of 2018 will reauthorize Title VII Health Professions Workforce Programs for fiscal years 2019 through 2023. Title VII programs have expired, but have continued to receive appropriations. In fact, this year, the appropriations levels for those programs has increased. The amendment in the nature of a substitute changes the authorization levels included in the bill as originally introduced to reflect fiscal year 2018 omnibus appropriations. The amendment also incorporates technical assistance that we receive from the Department of Health and Human Services. Title VII of the Public Health Service Act includes various programs that are vital to building and maintaining a well-educated, well-trained physician workforce. The Empower Act reauthorizes funding for area health education centers at more than $38 million per year. These centers are critical in providing both medical education and healthcare services to medically underserved areas. There are also several programs to incentivize diversity in the workforce, including the Centers of Excellence program, which this bill authorizes at a level of $23 million per year. This program provides grants to medical schools that have a disproportionate number of minority students for the purpose of expanding the school's capacity or to improve curriculum. Additionally, the bill authorizes funding for our primary care training and enhancement program at nearly $43 million per year. This program provides grants to hospitals and health profession schools to develop and operate supplemental primary care training programs. This legislation makes strides towards modernizing the Geriatrics Workforce Enhancement Program and the Geriatric Academic Center Awards and authorizes them jointly at a level of about $40 million per year. With an aging population, our workforce does need to be adequately trained in handling the unique needs of seniors. This provides opportunities to train geriatric specialists to develop geriatric-specific programs in underserved areas. Reauthorizing Title VII programs is long overdue. I urge members on this subcommittee to support the bill. Are there any bipartisan amendments to the amendment? Seeing none, the discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor signify by saying aye. Oh, I beg your pardon. Oh, for what purpose did the gentlelady from Illinois seek recognition? The gentlelady is recognized for 5 minutes.
Thank you. So I am very pleased, Mr. Chairman, to lead H.R. 3728 with you, the Empower Act. This bill includes provisions to reauthorize the Geriatric Healthcare Workforce Development Grant Program. It works to fully achieve the goal of supporting tomorrow's health providers. Our nation is facing a severe and mounting shortage of healthcare professionals to meet the need of older Americans. It is estimated that by 2030, 3.5 million trained healthcare workers will be needed just to maintain the current access level for older Americans. This means that unless we act now, seniors, especially those with multiple chronic conditions and cognitive impairments, may not receive the quality of care they need. The reauthorization of geriatric workforce enhancement programs and reestablishment of the Geriatric Academic Career Awards are critical in addressing this shortage. This bill confronts the challenge head-on, as the Geriatric Workforce Enhancement Program is the only federal program dedicated to developing a healthcare workforce that maximizes the engagement of older adults and family caregivers while improving health outcomes. Taking affirmative steps to achieve these objectives is essential to ensuring that all of us have access to high-quality health care as we age. Geriatric workforce enhancement programs promote interdisciplinary team-based care by integrating geriatrics with primary care delivery systems. These programs improve the quality of care delivered to older Americans by providing education to families and caregivers on critical care challenges like Alzheimer's disease and related dementia. In Chicago, Rush University Medical Center is one of the outstanding health and education institutions to receive a grant from the Health Resources and Services Administration to administer a geriatric workforce enhancement program. At Rush, providers are trained to better care for older adults, and this training will continue to benefit more and more people as it expands our workforce. This bill also reestablishes the Geriatric Academic Career Awards, which allows training programs to reach more underserved and rural communities. Since 1998, original Geriatric Academic Career Award recipients have trained as many as 65,000 professionals in geriatrics and have contributed to geriatrics education, research, and leadership across the United States. These critical programs that train professionals with an emphasis on engaging the whole continuum of care for seniors. This means training geriatric specialists to involve home health care aides, family caregivers, and primary care doctors. I was encouraged to see that in last year's appropriations, fiscal year 2018, we increased the funding for these geriatric workforce programs by $2 million. I am hopeful that as we continue working on this bill, we can raise the authorization level to $51 million so that we can continue to $51 million so that we can continue to invest in the well-being of our nation's seniors. Because whether you are young or old, every one of us will need care as we age. Investing now in this workforce is the best way to ensure that we're prepared to provide the health care required. This bill is a great start. Thank you, Chairman Burgess, for your work with me on this bill, and I look forward to reauthorizing these critical programs. Thank you, and I yield back.
Gentlelady yields back. Chair thanks the gentlelady for her supportive statements. Are there any other members wishing to be heard on the bill? If there's no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor will signify by saying aye. All those opposed, no. The ayes appear to have it. The ayes have it, and the amendment in the nature of a substitute is agreed to. Question now occurs on forwarding H.R. 3728.
Move to strike the last word on the bill.
For what purposes, gentlelady?
Move to strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. I want to thank you and Congresswoman Schakowsky and Congressman Bouchon for sponsoring the Empower Act. And just want to mention, I know everyone on the committee is very concerned about the modern healthcare workforce and how we promote diversity within the healthcare workforce. And I wanted to mention to everyone, to members, to the professional staff, to interested members of the public, that today in Rayburn 2043, the Bipartisan Congressional Academic Medicine Caucus, yes, there's such a thing, it's kind of known as the GME caucus, that I invite you to attend a bipartisan briefing that is being put on by the Association of American Medical Colleges on just this topic. The lunch briefing will examine how federal policies can support increases in both accessibility and quality of care for underserved communities, how we address the gaps in workforce diversity. But we have a great panel of experts and medical professionals who are going to lead this briefing, so I encourage everyone to attend, and note that lunch will be provided. And I yield to Congresswoman Schakowsky.
I neglected to thank Representative Bouchon. I thank him very much for participating and co-sponsoring this legislation as well. Thank you. I yield back to...
Chair thanks, gentlelady. Gentlelady yields back. Is there further discussion? Seeing none, the question now occurs on forwarding H.R. 3728 as amended to the full committee. All those in favor say aye. All those opposed, no. Ayes appear to have it. Ayes have it, and the motion is agreed to. The chair calls up H.R. 5385 and asks the clerk to report.
H.R. 5385, to amend the Public Health Service Act to reauthorize the program of payments to children's hospitals that operate graduate medical education programs and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill is open to amendment at any point, so ordered, and I will recognize myself to offer an amendment in the nature of a substitute, and the clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 5385, offered by Mr. Burgess.
Without objection, the reading of the amendment is dispensed with, and the chair is recognized for 5 minutes in support of the amendment. According to the proposed fiscal year 2019 Labor, Health and Human Services and Education Appropriations Bill, Children's Hospital Graduate Medical Education will receive $325 million, which is an increase of $10 million above the enacted fiscal year 2018 level. The amendment to H.R. 5385, the Children's Hospital GME Support Reauthorization Act of 2018, updates and aligns the funding levels in the bill with the level established in the fiscal year 2019 House Labor and Human Services Education Appropriations Bill. I think every one of us on this subcommittee agrees that our children deserve the best care available to them, and ensuring that we have an adequately prepared pediatric workforce is vital to providing quality health care to our children. Currently, hospitals that receive Children's Hospital Graduate Medical Education funding train nearly half of our nation's pediatricians and pediatric subspecialists. Prior to the establishment of Children's Health Graduate Medical Education, these children's hospitals received minimal graduate medical education funding because Medicare is the primary funding source for graduate medical education programs, and children's hospitals have few Medicare patients. The annual $325 million authorization level for fiscal years 2019 through 2023 is a positive step in helping Children's Hospital address their workforce shortage issues. I obviously urge support of this amendment and the underlying bill. Does any other member seek recognition on the amendment? For what purpose does Mr. Green seek recognition?
Mr. Chairman, I strike the last word
Jones recognized for 5 minutes.
and speak in support of H.R. 5385 and the amendment in the nature of the substitute. The Children's Hospital GME Support Reauthorization Act. I'm proud to introduce this legislation with Dr. Burgess that would reauthorize Children's Hospital Graduate Medical Education Program. The CHGME payment program was created to authorize payments to children's hospitals support medical residency training programs. Although most hospitals typically receive GME funding through Medicare, pediatric hospitals treat very few patients enrolled in Medicare, denying those hospitals similar support from the federal government. The GHGME program provides needed funding for training pediatric workforce, including pediatricians and pediatric subspecialists, as well as physician types and non-pediatrics focused specialists that rotate through Children's Hospital for a period of time during their residency. Since its creation, the payment program has made it possible for thousands of pediatricians to receive training. These physicians receiving training in one of the 58 freestanding children's hospitals in 29 states go on to serve in rural and underserved areas, helping to alleviate the pediatric workforce shortage impacting communities throughout America. The CHGME program is needed now more than ever to help train the pediatric workforce, which will be required to meet the needs of our children and grandchildren. Our legislation will authorize the GHGME program for 5 years with a 10% funding increase. The current authorization will expire at the end of the current fiscal year, so it's important that we reauthorize this program. As of today, our bipartisan legislation has 61 co-sponsors, equally divided between Democrats and Republicans, including many members of our committee. The legislation has strong support from outside stakeholders, including the American Hospital Association and the Children's Hospital Association. And I ask my colleagues to join Dr. Burgess and myself in supporting this important legislation. I yield back my time.
Will the gentleman yield to the gentlelady from Tennessee?
Glad to yield to Marsha.
Move to strike the last word, and I thank the gentleman for yielding, and I do speak in favor of this amendment in nature of a substitute. The importance of this should be recognized, and I thank everyone for the bipartisan work on this. As an example of how this is used, St. Jude Children's Hospital receives $2 million a year from this program. They use this to train 40 physicians, oncologists in a subspecialty every year. And then these physicians not only serve Tennessee, but children in other states who are suffering from cancer and related diseases. So I appreciate the good work on this. I'm pleased to be a co-sponsor, and I urge support and yield back.
Gentlelady yields back to the gentleman from Texas, who also yields back. Are there any other members seek recognition? For what purpose does the gentlelady from California seek recognition? Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. I just want to say quickly how really pleased I am that the committee comes together to support this magnificent program. The graduate medical education that produces one generation after another of just extraordinary physicians that take such extraordinary care of those that need extraordinary care. I think it's a jewel in the crown of our healthcare system in the country. I see it firsthand at Lucille Packard Children's Hospital in my district, the children's hospitals, which are a source of pride to all of us, especially the members that have a children's hospital in our district. So bravo to the committee for doing this once again. It's so important to our country, and I think it's really one of the great sources of pride, not only to me, but to and the members of the committee, but all the members of Congress. So thank you, and I yield back.
Chair thanks the gentlelady, and gentlelady yields back. If there's no further discussion, the vote occurs on the amendment in the nature of a substitute. All those in favor signify by saying aye. All those opposed, no. The ayes appear to have it. The ayes have it. The amendment in the nature of a substitute is agreed to. Question now occurs on forwarding H.R. 5385 as amended to the full committee. All those in favor say aye. Aye. All those opposed, no. Ayes appear to have it. The ayes have it. The motion is agreed to. We have one last bill. We'll take a quick 15-minute recess and reconvene at 10:15 without objection, so ordered. Bathroom break, sorry.
Yeah, oh, I understand. It's also a product of our age.
Call the subcommittee back to order and thank everyone for their indulgence. The chair calls up the committee print entitled Pandemic All Hazards Preparedness Reauthorization Act of 2018 and asks the clerk to report.
Discussion draft to reauthorize certain programs under the Public Health Service Act and the Federal Food, Drug, and Cosmetic Act with respect to public health security and all hazards preparedness and response and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill is open for amendment at any point. So ordered. The chair recognizes Ms. Blackburn of Tennessee to offer an amendment.
Thank you, Mr. Chairman. I have an amendment at the desk.
Clerk will report.
Amendment to the committee print offered by Mrs. Blackburn.
Without objection, the reading is dispensed with, and the gentlelady from Tennessee is recognized for 5 minutes on her amendment.
Thank you, Mr. Chairman. This amendment requires the Assistant Secretary for Preparedness and Response at HHS to do 3 things. First, the amendment requires the Assistant Secretary to report to this committee on a weekly basis regarding the status and welfare of children separated from their parent or guardian who are awaiting reunification, as well as the number of children in facilities funded by HHS. Second, the amendment requires the Assistant Secretary to submit to the committee a formal strategy to reunify children who have been separated from their parent or guardian and placed into a facility funded by HHS. And finally, this amendment requires the Assistant Secretary to submit to the committee a strategy to address deficiencies identified by the committee as early as 2014 regarding HHS oversight of and care for unaccompanied children in their custody. And this is an issue, Mr. Chairman, that you and I have worked on since 2014, looking at the care and the welfare of the children that were in these Office of Refugee Resettlement facilities. And I have a body of letters that we have written, that we wrote in 2014, some of them from this committee, some of them that you and I wrote seeking guidance from appropriators looking to freeze funds and withhold funds until we made certain that these children were being properly cared for and that these facilities were being operated in a way that brought transparency and accountability so that we knew the welfare of these children were first and foremost in what was being handled. And of course, we realize these facilities are operated by contractors. This is something you and I and others have recently, in recent days, talked with HHS regarding this matter. And I think that it is appropriate that we ask for these 3 simple, very specific steps. And I would be happy to yield time to Mr.
Gentlelady, yield.
I will be happy to yield to Mr. Upton.
I want to say I appreciate this amendment, and I know I join most, if not all, of my colleagues in trying to find a solution to this zero tolerance policy. But I just want to remind our colleagues that we've been, as a committee, engaged in this for some time, and I would like to put into the record 3 letters that I wrote as chairman of the full committee back in 2015 and 2016 to Secretary Burwell, asking for information relating to the separation of parents. They provided a number of documents. We made some progress, I think, because of this committee's work. ORR has been dramatically improved. There's more clinicians available to kids. They're conducting more follow-up after children are placed with sponsors. And it's an issue that we shouldn't shy away from. And I am very much in support of the gentlelady's amendment and yield back.
I appreciate the gentleman's support.
Without objections, ordered will be made part of the record. And Chair thanks
Are
again.
other members seeking to speak on this? Mr. Chairman, I will just say, as we have sought to protect these children that were in the custody of ORR, that we make certain that those caseworkers who are working so hard to vet and verify and to make certain that these children are going to someone who is a family member, that we are not placing them in harm's way, that they're not being released to individuals who are not family members, that we need to have transparency, we need to have accountability into these facilities. We're fully aware that they're operating in 17 different states, and that there are over 100 facilities now. So I appreciate the agreement, bipartisan agreement, on looking at these facilities, and I yield back my time.
Chair thanks the gentlelady. Gentlelady yields back. Other members wishing to be heard on the amendment for purposes. Gentleman from New Jersey, seek recognition.
Speak in support of the amendment.
Gentleman is recognized for 5 minutes.
I just want our colleagues to understand why the Democrats proposed these 4 amendments, and I just want to speak from my own personal experience. On Father's Day, I went to the Elizabeth Detention Center in my home state with 7 members of Congress from New York and New Jersey, and we met with fathers who had been, in some cases, all of whom had been separated from their kids or younger siblings, but 3 in particular who had been treated, whose kids were taken away from them because of the President Trump's zero tolerance policy in the last few months. And neither ICE nor the prison facilities nor any of the fathers were aware where their children were, had no communication with their children. They were taken from them in some cases in the middle of the night, all without their consent, obviously. And when I asked ICE about the policy, I was told there is no policy to have these fathers know where their kids are or communicate with them. Last week I spoke with the Secretary of Health and Human Services. He said the opposite. He said there is a policy. They will be reunited. They can talk to their kids. But that's not happening. And so as much as I appreciate the gentlewoman's amendment, because from what I can see, and of course I just got this as you just got ours earlier, it would seem to incorporate both Mr. Lujan's amendment about the having a strategy and Ms. Schakowsky's amendment about the weekly reports. And so I do appreciate that, and I intend to support the amendment. But it doesn't provide for a hearing. And on June 20th, I asked the chairman, every Democratic member of this committee asked the chairman of both the full committee and the subcommittee to hold the hearing. And we have not gotten a response. And my sense of Congress resolution, which I still intend to move as an amendment, specifically says that we need to have a hearing immediately on this. And I don't say it because I just like to go to hearings. I mean, you could have it tomorrow, and you could have it Friday. It needs to be done soon. And the reason is because there is so much confusion about what HHS and ASPR are actually doing or not doing. And I'm not talking about media reports. Obviously, there are plenty of media reports that really suggest that they're completely ineffective and incompetent in what they're doing in this effort to reunite these kids. But I'm talking from personal experience, meeting with fathers in this case, and others have met with the mothers in Texas along the border, that we have no confidence whatsoever that the department is actually doing what they say they're going to do. They're saying they're going to reunite the kids. They're saying they're going to be able to talk to their kids. They're saying all these things. But it's not the case. It's not happening. And that's why we need a hearing. Just having weekly reports and saying that they're going to put together a strategy is not enough, because the proof is in the fact that they haven't actually done these things. And I think if you don't have a hearing, and if this committee doesn't take on that oversight responsibility immediately, we will not get to the bottom of this. So as much as I appreciate the gentlewoman's amendment, and I will support it, and I urge my colleagues to support it, I would request, Mr. Chairman, either Mr. Walden or Mr. Burgess, that we have an immediate hearing, and I do intend to pursue that sense of Congress because of what's actually happening out there. I'm not making this up. I saw it myself, and I continue to be concerned. I don't know if I have a minute.
If the gentleman would yield.
Yes, sure, I will yield.
I appreciate that. In 2014, when I first visited the retention centers and the reception centers also, it was appalling to me as a mother to see these conditions. And that is why at that point in time, I started to work on this issue and to bring this forward. So I think that what we need to do is pull forward this entire body of work, the letters that Mr. Upton did, the letters that Mr. Burgess and I did.
Take my time back with the
And-
30 seconds. I don't disagree with you, but I'm not talking about the conditions of the facilities. I understand you have that in your amendment. I don't have a problem. I will support that. But what I'm saying to you is I'm not talking about the conditions of the facilities. That's an ongoing issue that certainly can be looked into. I'm talking about the fact that I am worried that these kids are not going to be reunited. I am worried that the parents, in the case of the ones that I'm aware of, have no knowledge of where their kids are and no communications with them. That's what needs to be addressed. You want to add the other? I don't have a problem. But that's why we need a hearing to address the immediate problem of the separation of the kids and the failure of the department to reunite them and have communications with their parents. That's my concern right now. So I'm done, Mr.
Gentleman's
Chairman.
time has expired. Other members seeking to be heard on the issue. For what purposes, the gentleman from Texas seek recognition.
I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Mr. Chairman, and I want to thank my colleague from Tennessee for bringing up this amendment. I have one that would actually require for daily reports to our committee. The critical aspect of the work of the Assistant Secretary for Preparedness and Response is to track and reunify families separated from their loved ones as a result of disasters and public health emergencies. In fact, ASPR website notes that tracking and reunification is a key aspect of the disaster management and recovery, while acknowledging it can also be one of the most challenging. I believe we are facing a man-made disaster at the hands of the Trump administration, as their zero-tolerance immigration policy has resulted in forced separation of children from their parents at our southern border. This amendment would require, my amendment would require the Assistant Secretary to report on a daily basis, but I agree with my colleague, weekly would be fine, but I want those reports to come to our Energy and Commerce Committee on the status and welfare of the children currently in custody of the Department of Health Human Services Office of Refugee Resettlement, as well as a number of such children still awaiting reunification with their family. This is critical information that Congress needs to in order to effectively conduct oversight and to understand the implications of the administration's action. We need real-time data, information on the status of these children and how HHS is working to fix this man-made disaster. These children must be reunited with their families as quickly as possible, and we know, and we need to know how the administration is going to do that. I also ask that, Mr. Chairman, like my ranking member, that immediately when we come back after the 4th of July break, that either the Health Subcommittee or the full committee hold a committee hearing and bring in people from HHS, because that's our job as a committee member here and in Congress to see how it's working. And Mr. Chairman, I'd like to ask unanimous consent to place into the record 2 letters from the American Medical Association and the American Psychiatric Association explaining how this separation is detriment to these children. And just imagine, I have 2 children who are now grown, but I have 4 grandchildren, how it would be on any of us who couldn't find our children, no matter what we did or how we got here. They don't know it, and that's what's frustrating here. Weeks into it, we're having, I ask unanimous consent to put these into the record, Mr. Chairman.
Objection so ordered.
And I yield back my time.
Gentleman yields back. What purpose does the gentleman from Oregon seek recognition?
Strike the last word.
Gentleman's recognized for 5 minutes.
I appreciate the comments from all our colleagues. I think we share a common concern here about the health and welfare of these young children and their parents. And that's what leads to the amendment that we have before us today. I want to commend the gentlelady from Tennessee for offering up this amendment so we can get more information in a timely basis and that we get assurance that they have a strategy for reunification. I would just suggest to my colleagues on both sides of the aisle that we are doing our oversight work. We have been in regular contact with HHS, as I believe you all have as well, with the staff level. And we will be also submitting a series of questions to HHS, and we would welcome your participation in that letter that we will be putting together. because we want to get the answers as well. We know back in 2014, tragically, some children were released to people that turned out to be less than worthy and ended up in forced labor rings in Ohio. That's now been documented. And so I think it is also in the children's benefit to make sure that we know who they're being turned over to, and that in some cases, it could be the very coyotes that snuck them across the border, who have ill will and evil in their heart. And so I think it is a difficult situation. We want this cleaned up. And I believe today on the House floor, we'll have an opportunity to vote on a law that would both secure our border, take care of DACA kids, and resolve some of these issues that are before us today. And so we have an opportunity there. We have an opportunity with this amendment, and we will do our due diligence on this issue going forward. And I yield back and ask our colleagues to support this amendment.
Chair, thanks, gentlemen. Gentleman yields back. Other people seeking recognition. What purpose does the gentleman from New Mexico seek recognition? I'm sorry, the gentlelady from Florida.
Well, thank you, Mr. Chairman. You know, this amendment
He's
calls...
recognized for 5 minutes.
I move to strike the last word. This amendment that calls for reports, written reports, really is an abdication of responsibility by this committee. There is no substitute for having oversight hearings. And we, the Democrats, last week called for immediate oversight hearings. And this is really the first response we've had from our GOP colleagues. Meanwhile, it's been up to a federal judge now who ruled late last night or this morning that it's frankly outrageous that the Trump administration had no plan to reunify families. This judge said there's no genuine dispute that the government was not prepared to accommodate these separated children. Measures were not in place to provide for communication between governmental agencies responsible for detaining parents and those responsible for housing children, or to provide for ready communication, even communication between separated parents and children. There was no reunification plan in place, and families have been separated for months. So now the only answer from my colleagues on the other side of the aisle is to let's have reports rather than ask the agencies to come here and explain. What should have happened last week when it became apparent, this tragedy became apparent, the Congress should have acted. They should have acted immediately. And at the very least, this committee that has oversight responsibility for HHS should have called those agency officials to come and explain how they're going to reunify families. If they don't have a plan, we can help them develop a plan. But now you're abdicating your responsibility as a member of Congress, leaving it to the courts when we should be the ones to take action. This committee over the last week has had hearings on all sorts of various topics. Are you telling me that all of those hearings, the subjects of all of those hearings, it's more important than reuniting kids, some toddlers, some babies, with their parents that are hundreds of miles away? I think that's a real abdication of your responsibility. So let's pass this amendment, but we have some other important amendments to pass too about actually the committee actually functioning, actually playing its important role in this democracy, actually representing our families back home who are ringing our phones off the hooks and demanding action. So I think this is kind of a sorry state of affairs right now. Let's actually pass an amendment let's actually have a hearing today. Why don't we ask the folks who are working in the building next door or down the street to come over and explain what the plan is. We have time to do this today or tomorrow or Friday. We can do this. We're members of Congress. Please don't minimize our role here. Let's get these families together and understand what resources are needed to make sure that babies, toddlers, other kids who are separated can actually see their parents. Otherwise, we know what all the health organizations have said. Thank you, Mr. Green, for putting this in the record, but here's the one from the American Psychological Association. The administration's policy of separating children from their families is not only needless and cruel, it threatens the mental and physical health of both the children and the caregivers. The longer that children and parents are separated, the greater reported symptoms of anxiety and depression of the children. And we know what the American Academy of Pediatrics has said, what faith-based organizations, the Conference of Catholic Bishops has said, all across the board. Why is it the GOP in Congress and in the Energy and Commerce Committee that they're the only ones standing in the way of really understanding how we get these kids back together quickly and safely? So sure, we'll pass this amendment, but let's move on to the amendments that have meaning and actually setting a hearing, Mr. Chairman and colleagues. I'll yield back my time.
Chair, thanks. The gentlelady. Gentlelady yields back. Other members seeking to be heard on the gentlelady, the gentleman from New Mexico seeks recognition.
Thank you, Mr. Chairman. And
5 minutes.
move to strike the last word, sir. Mr. Chairman, I want to, again, I'd associate myself with the remarks of my colleague from Florida, Ms. Castor, as well. But as it pertains to this amendment introduced by Ms. Blackburn, I want to recognize my colleague for recognizing my amendment. I understand, Mr. Chairman, this amendment was introduced minutes ago.
Yes, they were filed this morning.
Do we know what time it was introduced, sir?
Would have been introduced at 10:30.
10:30. Thank you, Mr. Chairman.
It's about an hour after yours.
I appreciate that. And I appreciate Ms. Blackburn including what's 99%, I think, of the language in my amendment in this amendment. I know that my colleague has always worked with Democrats, and I appreciate her acknowledging the good work product of an amendment that was introduced today. Mr. Chairman, I don't know if it's in order for me to ask unanimous consent that my name be added to the amendment, since a big chunk of this is there. So I'd ask unanimous consent that Lujan be added to Ms. Blackburn's amendment, Mr. Chairman.
Is there objection? The objection so ordered.
Objection.
There is objection?
Objection is heard.
No objection.
Oh, thank you,
Gentleman
Mr.
from
Chairman.
Oklahoma object?
I'll object to that, absolutely.
Objection is
I appreciate the bipartisanship of my good colleague from Oklahoma there. I'm trying to give Ms. Blackburn a compliment there, Mr. Chairman. But nonetheless, Mr. Chairman.
Point of order, Mr. Chairman. I did not hear which member went on the record not giving unanimous consent to that. Who was the member?
objection.
Mark Wayne Mullen from Oklahoma.
Thank you. Mark Wayne Mullen, thank you.
So, Mr. Chairman, look, I think that in the end here, I'm not certain why this amendment was needed when we already had an amendment that was authored, as that would be voted on. But it's unfortunate that even in the spirit of bipartisanship, that my colleague from Oklahoma would object to something where we're working together to be able to get our names authored together as we're trying to move policy. And I thought that bipartisan amendments were embraced by this committee. So I don't know, Mr. Chairman, I guess I was trying to get some more support there, Ms. Blackburn, in the way that you saw the language that was in here before. But, Mr. Chairman, as Ms. Castor said as well, the importance of the amendments that have been filed, I certainly hope that clearly the germaneness of the amendments has been made clear by allowing us to be able to hear this amendment today. And I certainly hope that the other bills will be kept in order, the other amendments will be kept in order, because they follow the same line here so that we can have a thorough conversation about what's been filed. So thank you, Mr. Chairman. I would yield to Mr. Sarbanes from Maryland.
Thank the gentleman for yielding. I just wanted to emphasize again the importance of our having a hearing following what Congresswoman Castor said, where we bring professionals in here who can tell us what these long-term effects are on children of separating them from their parents, because there's been a lot of discussion of that in the press, a lot of the organizations that have insight into these long-term effects, the toxic effects, really the assaultive effects that come from separating young children from their parents, have spoken to this. We need to assemble that expertise in our own committee, and the reason is this. I'm very much convinced that it was increasing attention to the long-term health impacts on children that became consequential in the decision of the administration to abandon this separation policy, as that got more attention out there in the public. If we had had that kind of information assembled already, we would have been in a position to enter the conversation early and maybe stop some of these separations from happening. At the very least, we should now try to make up for that omission, previous omission, get the professionals in here, assemble that information, and be ready, because I fully expect there will come a time down the line where children may again face these kinds of policy decisions. And at that point, we need to rapidly present the information and the evidence that indicates what an impact this can have, the long-term health effects of this kind of a policy. So we have a responsibility to arm ourselves, equip ourselves with that information that can only come from a hearing that this committee undertakes, to get it together so we can be ready to do our job and to positively contribute to the kind of discussion about what should happen in terms of this kind of policy at the border. So please let us have this hearing. As Congresswoman Castor said, it's our responsibility and obligation to do it, and I yield back.
Yield back. Gentleman yields back. For purposes, the gentlelady from California seek recognition.
Yeah. Mr. Chairman,
Oh,
can we have some majority recognition also, please?
I beg the indulgence of the former chairman. I had not seen any hands go up on the Republican side, but you are now.
I did it very quietly,
I
Mr.
see that you always do. For purposes, the gentleman from Texas seek recognition.
To strike the requisite number of words.
The requisite number of words are stricken, and the gentleman is recognized for 5 minutes.
I probably won't take 5 minutes, but, you know, the beauty of our committee, which I've been on 32 years, is that we do address serious issues. And I want to commend Mr. Pallone and Mr. Green and all the Democrats. They found an amendment that is germane to the pending legislation, and they drafted an amendment. And as soon as Dr. Burgess and Chairman Walden saw the amendments, and their staffs looked at them, they immediately said they're germane, they have a right to offer them. And we had a debate, or discussion, it really wasn't a debate, and the majority of the Republicans wanted to accept the amendments. So this is an example of the committee acting in a very responsible fashion in the appropriate way. That's a good thing. Now, since the amendments weren't talked about before this morning, there was some righteous indignation on our side that we were being a little bit sandbagged. And that may be right, may be wrong. And so, you know, we decided that we were going to offer an amendment in a second degree, and that's what Congresswoman from Tennessee did. And that's a good thing, too. There is nobody, I don't know of anybody on either side of the aisle in this committee that is for separating children from their families. I don't know anybody that's for that. Whether you're the hard right or the hard left or somewhere in between. But treating that is treating the symptom. It's not the cause. The cause is a broken immigration system, that we have some existing law and court rulings that say if you bring a child illegally into this country, you can only detain the child for 20 days and then the child has to be released. We have, rightfully so, a system of political asylum in this country that if you're really persecuted anywhere in the world, you can seek political asylum in the United States. And those two facts are being used by people that really are not being politically persecuted, and they're being gamed.
Mr. Barton, could I ask you to yield when you're finished with your statement?
Yes, sir. And I'll try to wrap up and give you at least 2 seconds to respond. No, I'll give you at least a minute. I believe we ought to change the current law. I think we ought to say, you go to the consulate or the embassy in your home country if you want to seek political asylum. That's the way we used to do it. Or I would, if you drag your children 1,500 miles across Central America and Mexico, sleeping on the ground, exposing them to all kinds of hardship, instead of doing that, let's try to solve the problem at its origin. But if we're going to have a system that you can get a get-out-of-jail-free card and be allowed into the country for 2 to 5 years on personal recognizance, under the current system, there ought to be a way to change that, and that's the cause, in my opinion. Anyway, with that, I'm going to yield to my friend from New Jersey.
Let me explain the problem. First of all, the immigration larger issue isn't before the committee, so that's why we're focusing on the separation of families. I'm going to go back to my Father's Day visit. The three gentlemen that I spoke about whose kids were taken from them and had no communication still don't know where their kids are. One was a fisherman whose business partner was brutally murdered. He was escaping with his daughter because he was afraid that he or his daughter would be murdered, or in the case of the daughter, raped.
We're not trying to deny that.
I understand that, but that person and the other person who brought his 7-year-old younger brother, who was a soldier and was escaping because the drug cartel was now targeting him and his younger brother, 7 years old, because they had gone after the cartel. They can't go to the authorities in their Central American country and sit there for 2 or 3 years or 6 months or whatever and wait for political asylum. They're fleeing the violence and coming here. They both turned themselves in when they came over to the border.
Well,
all I'm saying here is that if you're going to reunite these kids, you can't just say to the HHS, give me your strategy, because they've proven they have no strategy and they're not competent. That's why we have to have a hearing. That's why we have to have a hearing.
When they do go before a magistrate, 90% or more are not considered to be valid claims. Somewhere between 5 and 10%.
I'm just saying you can't let
So there are legitimate claims, Mr. Pallone, but they're
Gentleman from Texas
also
controls the time.
overwhelmed by the illegitimate claims that are simply a scam to get into the country.
Gentleman from
stay
Texas
in
controls
that
the time,
country.
and the time
They have to
has
flee.
expired. For purposes, gentlelady from California seek recognition. Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. It is more than evident that there are long-held positions wrapped around emotions relative to immigration and the hundreds of subsets of issues that are a part of it. And we just heard some of it. I respect where everyone is coming from. I think we need to understand something before we can accept or reject it. And I think that one of the most important things that Congress does, and I always remind my constituents about this, is to do oversight, to do hearings, to learn from professionals what we need to know so that that becomes foundational relative to our legislating. In this case, relative to the separation of children, our committee, and I think we all agree, the chairman, the ranking member, that this committee has jurisdiction because HHS has a role to play in this, as does now ASPR, as I mentioned in my opening statement, as of last Friday. I went to Texas this weekend, went to Border Patrol intake facilities, and on to the Port Isabel ICE Center, and I never thought that I would ever witness a policy that our country would be carrying out. On the point of the children, I'm a first-generation American. My mother immigrated with her mother. My grandfather was already in the United States. They came through Ellis Island. My mother was separated from her mother. She told that story all her life. She didn't know the language. She didn't know where she was. She didn't know what people were going to do to her. All she wanted was her mother. She sobbed, she couldn't sleep, she couldn't eat. She always talked about all the tags that were on her. and there was someone that recognized her surname as being Armenian, and the woman spoke Armenian to her and comforted her and lay down on her cot with her, sang to her so that she could fall asleep. Now, at 90-plus years old, 2 nights before she died, in her sleep, she was still calling out for her mother. That remained with her entire life. So, Mr. Chairman, this committee has the responsibility to get in and under issues. I support the language that the gentlewoman has brought forward. And I think the members on my side of the aisle do too. But we do a disservice to what's taking place in the country, to understand it and have these agencies. When I was in Texas, one of the things that was apparently clear, and these agencies and the people that are Border Patrol and ICE, they have very tough jobs. They're trying to do their jobs. But I am not exaggerating when I say it's chaos. They don't know exactly. They're conflating the policies. We need to know what HHS is actually going to do. This is not a ploy. And I think that some members think that it is. Look, Representative Brooks and I want more than anything else for our legislation to be taken to the full committee and reauthorized. So, but we really have the responsibility to do more. We need to do more. And I think in your heart of hearts, I know many members on the other side, look, who's for the separation of children from their parents? No one is, when you get down to it. But we need to make sure that we know the agency that's under the jurisdiction of this committee, what exactly they are going to do. My mother's name was Alice. I don't want more Alices created. And that's what's going on. I saw it, I met with them, talked to the mothers. This is a stain on the soul of our country. But professionally, we need to have the agency come before us. So I would ask, Mr. Chairman, that there be a hearing scheduled ASAP. ASAP. We have the responsibility to do that, and I yield back. Thank you.
For what purposes, gentlelady from Indiana seek recognition?
Move to strike last word.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman, and I appreciate my good friend and colleague's story about her mother, and thank you for sharing that. And I agree that we must do more, and I do want to enter into the record a letter that 41 of my colleagues signed last week to Secretary Nielsen, to Secretary Azar, and to Attorney General Sessions. A 2-page letter with 8 very pointed questions about the policies and procedures that they are using as decisions are being made about the separations of the families, with the emphasis that we, like all of our colleagues here, believe there is nothing more important than family, and that we do not, and we believe in protecting the well-being of these children and of the parents. And so I would ask unanimous consent, but I think in a letter such as this, asking for the type of training, the type of procedures that are being used, asking for numbers, asking for policies, it goes into in an even greater detail than what we could even get out of a hearing in many ways. By requiring and asking them for written response to very detailed policy questions. And so I'd ask unanimous consent to submit this letter.
Would the gentlewoman
there
yield?
was a short period, I understand there was a short period of time that maybe members had, at least on our side of the aisle, to get on to this letter. But yes, I would yield, and then I'd also like to yield time.
I just have a quick question. I appreciate what the gentlewoman is sharing with us. Have you had a response from anyone?
It was just sent on June 21st, and I would have to ask Mr. Stivers as to what kind of response he has gotten. He led the letter. But I believe that there will be a response, and if not, we will resend this letter. But 42 of us in a very short period of time signed on to a letter last week.
Well, and I would just comment
Is
that
there
I think
objection
that
to
that's...
including the record in the letter in the record? Seeing none, so ordered.
Thank you.
Would the
I would yield the
gentlewoman
balance.
yield,
I
would
I
you
like
just
to-
yield?
oh, Yes, I'd like to yield some time to the Congresswoman from Tennessee, who asked for some time.
Gentlelady from Tennessee.
Thank you, Mr. Chairman. One thing I want to point out as we discuss this is, yes, you know, all of us, as Ms. Eshoo said, when you're a parent, no one wants to see children separated from their parents, and it is heartbreaking. And the issue is broader as we look at these children and consider their well-being, children that came to the border. And reading from a letter that I sent on back in March of 2015, ORR released 53,500 unaccompanied alien children into our country to adult sponsors in 2014. Now, here is where this is an issue that is so heartbreaking. We have caseworkers in these facilities, and they seek to vet these individuals that are receiving these children. They don't know if these individuals are in the country legally, if they are indeed related to the child, if they were going to be in labor groups or sex trafficking, which in my opinion is horrific and is modern-day slavery. They don't know if they're going to gangs. And so we have sought to make some policies. So as we all are seeking to bring transparency and accountability and to clean this up, let's go back to this agency's inception, which is what we had started to do or sought to do in 2014. Let's make certain that these children and these parents know that these children are being appropriately cared for when they're released to individuals. Let's make certain that these are individuals who have the child's welfare at heart. So let's do this job. Let's gather this information. Ms. Brooks has noted the letter that they have submitted requesting information. And then in a bipartisan manner, let's address this issue and clean up this Office of Refugee Resettlement and make certain there is transparency and accountability brought to these facilities. And I yield back to the gentlelady from Indiana.
I am sorry to the ranking member, my time is up, and I yield back.
Gentlelady yields back. Other members seeking to be heard. Gentlelady from Illinois, what purpose do you seek recognition?
I too am the...
Gentlelady is recognized for 5 minutes.
Thank you. I appreciate that, Mr. Chairman. I too am the child of parents not born in the United States, came as children. They were fleeing persecution as Jews, their families from Russia, and made a great life for themselves. My grandfather pulling a horse and wagon down the alleys of Humboldt Park in Chicago, and selling vegetables, schlepping them upstairs in the back alleys, and sending 4 children to college. I want to say that I'm happy that the amendment offered by my colleague from Tennessee does include what I was going to offer as an amendment, the weekly reports. And by the way, this is a week since that letter was sent by 41 Republicans, and still I apparently have not received a response, or maybe, I don't know if there is one. But I'm really, really perplexed. Given all the hearings that we have and all the members from, all the representatives from agencies, the top people coming in and sitting before us and asking questions about issues that are important, but not as important as this one. And the suggestion that we needed to somehow separate the children in order to verify the relationship with the person that brought them is not really what the law is. The law, until there was an exclusion by the by the Attorney General for people, victims of life-threatening situations, gangs and domestic violence, that they were entitled to, and that's the law, to have an asylum process that would not separate the children. And that process would reveal whether or not they were legitimate, and I would argue that these are families, by and large, maybe a couple situations that we want to investigate that aren't, of loving parents bringing their children so that they aren't the victims of the violence that some of their other children have been. We know of parents whose one child has been killed, another paralyzed, and this desperate mother brought the last child with her to seek refuge in a country that has offered that since our beginnings. I think the Statue of Liberty is weeping today over the way that we've treated children. I want to quote from Blaise Kupich, Archbishop of Chicago, on this policy. There is nothing remotely Christian, American, or morally defensible about a policy that takes children away from their parents and warehouses them in cages. This is being carried out in our name, and the shame is on all of us. But this committee has an opportunity to shine the light that is needed, to ask directly to the people who are in charge. How is it that there was no policy? How is it that there was no plan? How are you going to implement the amendment I hope we pass today that says every week we want to know about the children that have been reunited? We have heard about a child, and maybe this is common, whose mother has been deported. This child is in foster care, and now there are efforts to end parental rights and put this child up for adoption. Imagine that, a loving mother somewhere in this world, and that child of hers would be adopted. You know, Cardinal Kupich ended with, every so often, history presents circumstances that test the soul of a nation. We are living in one of those moments. Whatever this nation of immigrants does for the least of these brothers and sisters of ours will define us for decades to come in the world's eyes and in God's. We have an opportunity to have a hearing and focus the light of the world on what is happening here and come up with an answer, answers to the questions that must be asked. And so I think in the name of humanity, let's not just write letters, not just pass amendments, but let's ask these questions in the public eye because people want to know, deserve to know. The American soul is at stake. I yield back.
Chair, thanks, gentlelady. Gentlelady yields back. Other members seeking recognition. For what purposes, gentlemen? Oh, sorry, the gentleman from North Carolina. For what purpose do you seek recognition?
Mr. Chairman, I ask to strike the last word, please.
Was recognized for 5 minutes.
Thank you very much, Mr. Chairman. Mr. Chairman, I was listening to the gentlelady from Tennessee a few moments ago, and I really appreciate her remarks, particularly as it relates to how we need to work together on this issue in a bipartisan manner. But I want to continue to express my disapproval and disappointment, rather, that Mr. Mark Wayne Mullen was unwilling to accept Mr. Lujan's name as an original co-sponsor of the amendment. Mr. Lujan offered almost an identical amendment at 9:30 this morning, and the other amendment from my friend was introduced at 10:30. Something just that simple flies in the face of bipartisanship that the gentlelady has talked about, and so I just want to to ask him to please reconsider allowing Mr. Lujan to join the amendment. Yes, Mr. Chairman.
Just point out to the gentleman that when I sat on the minority side of the dais and Chairman Waxman was in this chair, we were required to submit all of our amendments 2 hours prior to them being heard.
Reclaiming my time. This
As a
is
courtesy, as a courtesy
Yes.
to the minority,
Yes.
that policy is not enforced currently. It is possible to go back to the ways of Chairman Waxman, and I'm considering that very strongly this morning. So I thank the gentleman for his comments.
Thank you. Thank you, reclaiming my time. And thank you for that, Mr. Chairman. I didn't know where you were going with it, but thank you. Thank you so very much. Let me also go on record.
If the chairman would yield, I'd like to answer your question.
Yes, if we can do it briefly, because I also want to yield to Mr. Pallone, but yes.
Well, I get that, but you asked me to reconsider, and here's my objection to this. Mr. Lujan wanted to be asked to be added to the bill after he gave an extremely backhanded compliment to Marcia. If he wants to be on it, that's fine, but don't be a smart aleck by going out there and saying, when was it amended? It sure seems a lot like mine. I get that. I want to work in a bipartisan fashion too, but don't go out there and start being...
Reclaiming my time. I'll ask
Butterfield, could I just ask to be recognized?
Reclaiming my time. I would just ask respectfully that you think this through. All of your colleagues over there were ready to accept Mr. Lujan as an original co-sponsor until you objected at the very last minute. That flies in the face of what Ms. Blackburn was talking about and doing stuff in a bipartisan way, and I just is very disappointing, particularly on an issue as sensitive and as important as this issue is. Mr. Lujan, I'll yield to you momentarily.
Mr. Butterfield, all I would just like to do is respond to my colleague from Oklahoma. Mr. Mullins, not even the sponsor of the amendment objected. It was you.
Yes.
So I apologize if you were insulted in any way. We're talking about important policy that was put together, drafted, language was recognized, it was included, and the strength of this committee has always been how we work in a bipartisan way. So I apologize with whatever's going on today, Mr. Mullins, but I certainly would hope that you would reconsider and see how we can work together. If not, I'll still vote for it, but I was just asking for that. Thank you, Mr. Butterfield.
Reclaiming my time.
Fair enough.
Yes.
I'll say, fair enough.
Yes.
I'll reconsider.
Yes.
This is what the whole comment was about. I'll reconsider it with that apology to Marcia. Now,
That's
you just said that you'll apologize if you do.
Yes.
Okay.
Reclaiming my time. Thank you, Mr. Mullin. That's bipartisanship. Thank you. I yield the remainder of my time to my ranking member, Mr. Pallone.
I just wanted to say briefly, and I guess it goes back to Mr. Barton again. Again, when I talk about these people that I met with on Father's Day, and I'm speaking from personal experience, that these were fathers, or in one case, an older brother of a 7-year-old, who were escaping violence to protect their kids, and they did not, or younger sibling, they did not have the time, and they could certainly not wait for some, despotic government and sit in that country while they applied for political asylum. But I just wanted to say again to Ms. Blackburn, I have no problem with this additional provision in your amendment that looks into the unaccompanied kids. But I would, and I'll support it, but we cannot, the issue now is the separation of families. And the reason we need a hearing, and we can't just go along with Ms. Brooks' letter, as well-intended as it is because when I got a response from the secretary to my letter, and I actually had a talk with him last Friday, he basically yesed me to death. I appreciate his calling. But he said, all these fathers should be aware of where their kids are. They should be able to talk to their kids. I don't know why they can't. And my response was, in a nice way, I didn't say it, well, obviously there's something wrong with your department, and we're not going to get that by sending another letter. We have to have a hearing and challenge them and the people in the department and say, why aren't you doing what you say you're going to do? You say you're going to reunite these kids. You say they can talk to their parents, but it's not the case. And that's why we have to bring them in here so we can challenge them and say, I love what you're saying, but it's not happening. That's why we need a hearing. Thank you.
Gentleman's time has expired. Other members seeking recognition. For what purpose does the gentleman from Massachusetts seek recognition?
Strike the last word, please, Mr. Chairman.
Gentleman's recognized for 5 minutes.
I won't use it all, Mr. Chairman. A couple of things. First off, appreciate the support of our colleagues on both sides of the aisle trying to end this policy. I do, forgive me, but I do think it's important when we all say that no one here believes that separating children from families is the right policy response. I believe that is true. The policy also got there somehow by somebody in the administration and was marketed by the administration as a deterrent. So before we sit there and say this is such a heinous thing that no one in the right mind would ever want, this was the direct objective sought by members of this administration to use as a deterrent, period. Period. So let's not whitewash that away and say that that didn't happen, because it did, and the record is very clear. Now, I'm heartened by a bipartisan response in our legislative branch to try to adjust that policy that is cruel and inhumane beyond words. But I'd point out two things. One, there's a young woman, a mother from Brazil, who presented herself from asylum at the U.S.-Mexico border, was found out with her, I believe it was a 9-year-old boy. She was found to have a credible claim of asylum because of domestic violence, because of the violence back in her home. And after being detained, examined, and released, was able to move to Massachusetts with the help of her stepfather. She had no way of tracking down her son. Gone. By word of mouth, she happened to find that there was a young boy with the same nickname at a facility in Chicago. It turns out that they were able to find her son in Chicago. The son is still being held by authorities in Chicago. Mom has been found to have a credible claim of asylum, released, free. I saw her last week. She cannot get her son. So I appreciate the efforts that are taking place on a bipartisan nature. I do not believe for a second that there's any one parent or any one colleague that could possibly try to defend the policies put in place. I do think, given the fact that these policies about reunification were clearly not put in place when the decision went forward, that it's worth pushing the administration to figure out how they're going to do this now. Because there is a young boy that is still searching for his mother, a mom that, with DHS permission, got on a plane and is in Chicago waiting for his release and still cannot get her son. We should be able to do this. And if the administration, for whatever reason, there's a delay on it, we should be pushing. Last thing I'll say, I do not believe there's any way you solve the crisis of what is taking place at our border on our border. A number of us have visited Guatemala, Honduras, El Salvador, a number of the countries where a number of these individuals are coming from. This is a long, hard problem. But you do not solve it by trying to deport more people more quickly without understanding that some of the circumstances that our Republican colleagues have spoken eloquently about. Violence, sexual trafficking, cartels, murder. Those don't get solved on our border either. They get solved by actually rolling up your sleeves and doing some long, hard work in trying to increase governance and development in those communities. And if any of you are willing to do that, I'm all in. But to think that we're going to increase deportation rates and that that's going to stop people from fleeing sexual trafficking for their daughter, it's just not going to happen. If it was my daughter, I'd do the exact same damn thing. Yield back.
Gentleman yields back. The chair will recognize himself for 5 minutes, strike the last word. Look, this is a complicated problem. I want to share with the committee. I'm also on the Helsinki Commission, and a hearing at the Helsinki Commission a couple of years ago, Chris Smith convened the hearing, and we heard from 2 young women who had been brought to this country and had been trafficked, and they had been trafficked by family members. So don't tell me that it doesn't happen, because it does, and we heard about it in our committee. But I want to speak to a story of separation, a story of separation that I have in my district back home. And there's a constituent I have, his name is Chris, served his country in Iraq, put on the uniform, the government said, we need your help. He went, and while he was serving his country in Iraq, his wife unfortunately contracted cancer and died. So Chris comes home, and now he's a single dad. He's got a preteen or teenage daughter. Against his better judgment, he lets her go to a sleepover one night. Kids being kids, they go to a convenience store across a busy street. She's struck by a car and killed. So about 1.5 years later, Chris comes to see me, and he's tried everything in the world he could, because The person who was driving the car that struck his daughter was in the country without the benefit of legal status. And Chris's question for me, and it still reverberates today. I put on the uniform and defended my country. I went and did what was required of me. I did my job. Mr. Congressman, your job was to defend the border. And had you been doing your job, my daughter would be here today. And that is a tough story, and one that each and every one of us has to examine within ourselves. These are tough decisions. They are not all in the jurisdiction of our committee. This one happens to fall in the Department of Health and Human Services. But if we're looking for easy answers, there are none. There are hard answers. And the good news for the gentleman from Massachusetts is there'll be a bill on the floor today, and he's welcome to support it and see if he can't further the cause of immigration reform. Are there other, I'm going to yield back my time, are there other members seeking time on the resolution? If there's no further discussion, the vote occurs on the amendment from the lady.
Mr. Chairman, I'd like to have a roll call.
Well, wait a minute, I can only do one thing at a time. Does the gentleman from Texas have a unanimous consent request?
Mr. Chairman, I'd like to amend my earlier unanimous consent request with other statements from the American Academy of Pediatrics, the American College of Physicians, National Academies of Science, Engineering, and Medicine, and the American College of Emergency Physicians, and the American Public Health Association, and these, along with the American Academy of Child and Adolescent Psychiatry, on the impact on children of their detentions. Ask unanimous consent to place in the record.
Is there objection to the gentleman from Texas revising his unanimous consent request? Seeing none, so ordered. For what purpose does the gentlelady from Washington seek recognition?
Strike the last word.
Gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. You know, as Americans, we're grateful every day to live in the land of freedom and opportunity. We celebrate America as the melting pot, and we are warriors for human rights, human dignity. And I think we all agree that separating families is inconsistent with our nation's values and everything we stand for. Now, the president has said that Congress needs to act. I think we agree, many Republicans and Democrats, that Congress needs to act to address the underlying issue of the separation. I just wanted to take a minute and remind the committee that the House is voting today on legislation that addresses the issue of family separation at the border, a solution that would clarify the Flores settlement to ensure accompanied alien minors apprehended at the border are not to be separated from their parent or legal guardian. This legislation would also authorize additional funds for family facilities to ensure that there's space to keep families together through the adjudication. It also includes important provisions to address border security and make sure that we are taking steps on the national security perspective, which is also very important. I just wanted to make the committee aware of that as we're working through this issue today, that there is other legislation that's also under consideration in Congress today that would take a very important step immediately. And with that, I'll yield to the lady from Tennessee.
I thank the gentlelady for yielding. And again, I appreciate so much the bipartisan attention to this issue. As I said, we have tried to pull this issue forward since 2014. And going back to another letter that from 2015, when we were raising this issue with families, Customs and Border Patrol reported that there was a 412% increase in family unit apprehensions in 2014. Now, this is why I say this is a broader issue, and yes, we have to address the issue of separation, but bear in mind, while you saw those 53,000 plus unaccompanied alien children that were going through the facilities, you saw this dramatic increase in the family units. And we sought at that time to say, Office of Refugee Resettlement and your contractors, let's get our arms around this issue. We are dealing with human beings. We are dealing with children. We are dealing with families. You have to be transparent. You have to be responsible. You have to be accountable. You have to bear in mind the fragile nature of these individuals that are coming to you for protection, for safety. When you're in these facilities, the health care, dealing with these issues, and yes, it was encouraging to me when I saw news reports this weekend of our colleagues going to those facilities and seeing this firsthand. That was something that was so encouraging because it said to me, we are going to come at this on a bipartisan basis. We are going to get these answers, and we are going to clean these practices up. So I appreciate the support. I look forward to making this a bipartisan amendment, and I would like to add Mr. Lujan to the amendment if there are no objections, and have this move forward in a bipartisan way. I yield back.
Without objection, the gentleman's name be added to the amendment. There's no further discussion. The vote occurs on the amendment. All those in favor shall signify by saying aye. All those opposed, nay.
Mr. Chairman, I'd ask for recorded vote.
The request for a roll call vote has been made. The clerk will call the roll.
Mr. Guthrie. Aye. Mr. Guthrie votes aye. Mr. Barton. Mr. Barton votes aye. Mr. Upton. Aye. Mr. Upton votes aye. Mr. Shimkus. Aye. Mr. Shimkus votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mr. Latta. Mr. Latta votes aye. Mrs. McMorris Rogers. Mr. Lance. Mr. Lance votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Long. Mr. Long votes aye. Mr. Bouchon. Mr. Bouchon votes aye. Mrs. Brooks. Mrs. Brooks votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Hudson. Mr. Collins. Mr. Collins votes aye. Mr. Carter. Mr. Carter votes aye. Chairman Walden. Chairman Walden votes aye. Mr. Green.
Aye.
Mr. Green votes aye. Mr. Engel. Ms. Schakowsky. Aye. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Matsui. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Ms. Eshoo. Mr. Cardenas votes aye. Ms. Eshoo. Ms. Eshoo votes aye. Ms. DeGette. Mr. Pallone. Mr. Pallone votes aye. Chairman Burgess. Chairman Burgess votes aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers votes aye.
Do you guys have Engel and Matsui? Yeah, okay. Yep, we got Cardenas.
Are there other members wishing to be recorded? The clerk will report.
Mr. Chairman, on that vote, there were 29 ayes and 0 nays.
The 29 ayes and 0 nays. The amendment is agreed to. Are there further amendments? For what purposes, the gentleman from New Jersey seek recognition?
Mr. Chairman, I seek to offer an amendment. I don't know if it's numbered, but it's the first of the 4 Democratic amendments that deals with the sense of Congress on having a hearing.
The clerk will report.
Amendment to the discussion draft offered by Mr. Pallone.
Without objection, the reading is dispensed with, and the amendment is open for amendment at any point. For what purpose, the gentleman from...
Strike the last word.
Gentleman is recognized for 5 minutes on his amendment.
Thank you, Mr. Chairman. As this committee is well aware, we are currently watching not only a moral crisis, but also a public health crisis unfold along our southern border as families have been ripped apart as a result of President Trump's zero-tolerance immigration policy. And I continue to have grave concerns about the well-being of the children currently in the custody of the Department of Health and Human Services Office of Refugee Resettlement, and the federal government's ability to swiftly reunify each child separated from their parent or guardian as a result of this policy. Congress must exercise its oversight function, and this committee should immediately hold a hearing on this issue so we can understand what the administration is doing to care for these children and what steps they're taking to reunify them with their families. This amendment expresses the sense of Congress that the Committee on Energy and Commerce should hold a hearing to examine the current status and welfare of those children who've been forcibly separated from their families, as well as the long-term implications of this policy and this administration's actions on the health of these children. This amendment echoes the request that was sent to Chairman Walden and to Chairman Burgess from each Democratic member of this committee last week that we hold a hearing on this matter immediately to examine both the current status of these children and the long-term health implications. And Mr. Chairman, I have that letter that was sent to you and Chairman Walden. I ask unanimous consent that be included in the record.
Without objections, ordered.
Thank you. The American Academy of Pediatrics has stated that the trauma from separating these children from their parents and guardians can cause irreparable harm and can affect a child's short-term and long-term health. I believe this could be a man-made public health emergency created by the Trump administration that will have lasting impacts on the roughly 2,000 children that were ripped away from their families for purely political reasons. We have an obligation to conduct an oversight and understand how these children are being cared for, how and if they can be reunited, and how this dark chapter in our lives could impact them in the future. As Secretary Azar said yesterday that he believes there is, quote, no reason why any parent would not know where their child is located, and that he can personally locate any child HHS's care within seconds. But we have given no indication on how this is feasibly possible or how long it can take to reunite each child with their parent or guardian. And as I stated before, I am not talking secondhand or from media reports. I met with 5 fathers, or in one case an older brother, 3 of whom were separated forcibly in the last few months when the zero-tolerance policy from the president was in effect. They had no knowledge of where their kids were. They had no way of communicating with them. And when I asked the person who was in charge of the corrections facility from ICE what policy they had, they said there is no policy. So even though the secretary has personally called me, and I appreciate that, next Friday, and assured me that parents will be reunited with their kids, that they can easily communicate with them, and that they will be told where they are, we know that that's not true. And I'm not saying he's a liar. I just don't think he knows what he's talking about or what the reality is. And so that's why we need a hearing. These are the kinds of questions this committee must get answers to, and the most efficient way to do that is to call the key officials involved in front of our committee to testify. This should not be a partisan amendment, as I believe all members of this committee care about the welfare of children in the custody of HHS and how we can ensure that they're reunited with their families as quickly as possible. And again, even though I'm talking about a handful of people of fathers that I met with, it's obvious from media reports that we still have no idea what the HHS policy is on reunification and communication with the kids. And there are many, many of these parents that still have not been reunified and have no communication. So for this reason, I urge my colleagues to support this amendment. I yield to the gentleman from California.
Thank you very much, Ranking Member Pallone. Thank you so much for this substantive amendment. Hearings are what we should be having on this issue that is facing us. I don't know how many hearings were held by Congress when people were held in internment camps. I don't know how many hearings were held when generations of families in the Native American community were torn away, children were torn away from their parents. But here we are today with the opportunity for us, the Congress of the United States of America, to have hearings and to have right before us the head of Health and Human Services, the Office of Refugee Resettlement, to answer the questions of the duly elected members of Congress who are here to represent the people of America, and anyone who steps on our soil. Justice should be served, and we should have those hearings. Thank you very much. I yield back.
Thank you, and I yield back, Mr. Chairman.
Thanks, gentleman. Gentleman yields back. Other members wishing to be heard on the Pallone amendment? Seeing none, the vote occurs on the amendment. All those in favor shall signify by saying, the gentleman requests a roll call vote. The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Barton votes no. Mr. Upton? Mr. Shimkus? Mr. Shimkus votes no. Mrs. Blackburn? Mrs. Blackburn votes no. Mr. Latta? Mr. Latta votes no. Mrs. McMorris Rogers? Mr. Lance? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Long votes no. Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Mullen? Mr. Mullen votes no. Mr. Hudson? Mr. Collins? Mr. Collins votes no. Mr. Carter? Mr. Carter votes no. Chairman Walden? Chairman Walden votes no. Mr. Green? Mr. Green votes aye. Mr. Engel? Ms. Schakowsky? Ms. Schakowsky votes aye. Mr. Butterfield? Mr. Butterfield votes aye. Ms. Matsui? Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Cardenas votes aye. Ms. Eshoo? Ms. Eshoo votes aye. Ms. Daggett? Mr. Pallone? Mr. Pallone votes aye. Chairman Burgess? Chairman Burgess votes no. Mrs. McMorris Rogers? Mrs. McMorris Rogers votes no. Mr. Upton? Mr. Upton votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Oh, he is recorded, sorry. Mr. Chairman, on that vote, there were 11 ayes and 18 nays.
Eleven ayes, 18 nays. The amendment is not agreed to. For what purposes, gentlelady from Indiana seek recognition?
I have an
Gentlelady have an
amendment at the
amendment at the desk. The clerk will report.
Amendment to the discussion draft offered by Mrs. Brooks.
Without objection, the reading is dispensed with, and the gentlelady is recognized for 5 minutes on her amendment. On her amendment.
Thank you, Mr. Chairman. I want to thank my colleagues on the committee for their work and contributions to this legislation that we are marking up today. I especially want to recognize our chairman, ranking member, subcommittee chairman Burgess, subcommittee ranking member Green for their efforts and leadership on this legislation. I'm particularly proud to be working with the original author, Representative Eshoo, and all the staff involved. I look forward, as we've also heard, in strengthening the bill as we move forward by adding provisions such as Representative Blackburn's Good Samaritan bill, Representative Burgess's Mission Zero bill, language from Representative Daggett addressing emerging threats to maternal and pediatric health, language from Representative Castor addressing a children's preparedness unit, working with Representative Hudson to address drug shortages, working with Representatives Shimkus and Cardenas to address antimicrobial resistance, working with Representative Carter on language directing CDC to award grants that study healthcare-acquired infections in hospital settings, and working with Representative Collins on concerns regarding storage containers used for the vaccines put into the Strategic National Stockpile. Our discussion draft includes several priorities from the FDA, CDC, ASPR, BARDA, and HHS. It includes several priorities from the bipartisan Blue Ribbon Study Panel on Biodefense. I look forward to, as we move forward, adding the rest of their recommendations as we can to this bill. But I must say that the manager's amendment does make technical and clarifying changes to the bill that incorporates a bipartisan agreement with the ranking member. Specifically, the amendment will eliminate the transfer authority in the Public Health Emergency Fund. This important fund creates the bridge when we face an outbreak like Ebola so that immediate funding is available that we can then supplement with emergency appropriations bills. In addition, the amendment requires the Secretary as well as GAO to conduct a review of the fund, including policies that may be needed to improve the fund, resources available in the fund, and the ability to use this emergency resources during a public health emergency. Additionally, the amendment changes the Strategic National Stockpile language so that CDC and ASPR will work in coordination to run the Strategic National Stockpile instead of codifying a full transfer to the ASPR. And finally, the amendment simplifies the cybersecurity language to explicitly incorporate cybersecurity into the National Health Security Strategy and put ASPR in charge of continuity of care in the event of a cyber attack. And with that, Mr. Chairman, I yield back.
Chair, thanks. The gentlelady. Gentlelady yields back. For what purposes does the gentlelady from California seek recognition?
Support of the manager's
recognized
amendment.
for 5 minutes.
Thank you, Mr. Chairman. I want to thank once again my friend and co-sponsor, Congresswoman Brooks, for the magnificent work that she's done on this legislation and for the time, for almost 2 years, the time that she's put in on this. I support the bipartisan manager's amendment because it makes important changes to the PAHPA reauthorization discussion draft that we're marking up today. The manager's amendment eliminates the transfer authority language in the Public Health Emergency Fund and replaces it with that of the Senate bill, which identifies how this funding can be spent, and it requires a review of this fund by the Secretary of HHS and GAO. I think this is very important. The fund is an important element of a public health emergency response, and the manager's amendment strengthens our legislation in order to encourage direct appropriations to be made into the fund. The manager's amendment also changes the strategic national stockpile language, which has been a concern of members from both sides of the aisle, so that both CDC and ASPR work in coordination to run it, instead of a full transfer to ASPR. It's imperative that the CDC maintain the important role in this strategic stockpile, offering subject matter expertise and establishing and maintaining relationships, very important relationships, with state and local health officials. Lastly, the manager's amendment makes much needed changes to the cybersecurity language in the discussion draft. It's a matter of when, not if, a cyber attack will target our nation's healthcare system. So the changes in this amendment more appropriately address the existing cyber capabilities at HHS. Each of these changes make improvements to our legislation, and I'm pleased that the committee could reach agreement on these important issues. I'll continue my active involvement with Congresswoman Brooks relative to additional changes, work with the stakeholders, and see that this is the best reauthorization of PAHPA. I yield back.
Chair, thanks. The gentlelady. Gentlelady yields back.
Mr. Chairman.
For what purposes the gentleman from New Jersey seek recognition?
Strike the last word in support of the manager's amendment.
Gentleman's recognized for 5 minutes.
Mr. Chairman, I support the changes made by the bipartisan manager's amendment. As you know, I raised 3 major concerns at the legislative hearing. 1, the use of transfer authority by the Public Health Emergency Response Fund 2, codification of the administration's decision to move the strategic national stockpile from the Centers for Disease Control and Prevention to the Assistant Secretary of Preparedness and Response, and 3, the inclusion of cybersecurity language that I had concerns about. I'm pleased that we could reach bipartisan agreement on all 3 of these concerns. First, we incorporated language from S2852, the Pandemic and All Hazards Preparedness and Advancing Innovation Act, passed and reported out by Senate Help, which would add requirements to the Rapid Response Fund, but not require that the fund be funded through transfer authority. Next, rather than codify the SNS under the ASPR's direction, we've added ASPR to the statute, clarifying that the Secretary shall collaborate with ASPR and CDC in operating the SNS while continuing to provide the Secretary the flexibility to determine which division within HHS is best positioned to direct the SNS. And finally, we reached agreement on several cybersecurity provisions to promote public health and healthcare sector preparedness and response capabilities in the case of a public health emergency caused by a cybersecurity incident. Those provisions will clarify that ASPR has the lead responsibility within HHS for ensuring continuity of care if such an incident occurs, and require the National Health Security Strategy to include a strategy for cybersecurity threats for establishing an effective and prepared health and healthcare system. I'm pleased that we reached agreement on these important provisions, but I know there's still more work to do, and I am disappointed that we couldn't get further before the subcommittee markup. But I know there are a lot of members who have priorities that they would like to see in the bill, and I know there are a lot of stakeholders who would like to see things added as well. And I'm committed to working with not only Chairman Walden, but the sponsors, Ms. Eshoo, as well as Ms. Brooks, and other members of this committee on a bipartisan basis to reach agreement on legislation as we move forward. We will obviously cooperate with the sponsors. So I urge my colleagues to support this amendment, and I yield back.
Chair, thanks, gentleman. Gentleman yields back. For what purpose does the gentleman from Illinois seek recognition?
Thank you, Mr. Chairman. You're very kind and recognize me. I appreciate that.
Gentleman's recognized for 5 minutes.
I appreciate, obviously, Congressman Eshoo and Brooks and their work, and for Susan mentioning the work that Congressman Cardenas and I are doing to add another piece to this, which is antimicrobial resistance. And many of you have heard me talk about it for many, many years. We just can't keep up, and then if something occurs, we don't have a stockpile to be able to comply. And then the real concern is we're hoping people have on the shelf, obviously, stuff to stop bacteria, and in hopes that we never use it. So how do you finance that? So we've got a lot of reports from BARDA and had stuff from the PCAST report. We're trying to push that together to make sure this gets included. I appreciate my colleague from California and his work, and we hope to bring that. And I'd like to yield to Congressman Cardenas for, if Congressman Eshoo would stop talking to him, then I'd like to yield to Congressman Cardenas for comments on the amendment that we're going to submit at the full committee.
Thank you very much. And it's been a pleasure working with you, Mr. Shimkus, Congressman Shimkus, and also I'd like to thank Congresswoman Eshoo and Brooks for the fine work that they've been doing, and all the stakeholders and everybody involved and all of our colleagues. I just want to remind us that there are a few of these matters that are in development right now, and that's dangerous because antibiotic R&D needs to flourish and needs to continue. And let me just give you an example of what's going on today in our world, in the United States of America. 2 million people get serious antibiotic-resistant infections each year. And in addition to the human costs, we're talking about $20 billion in medical costs and $35 billion in lost productivity and wages every year. This is something that we can get in front of. And this bill and what we've been able to involve in it is going to make a tremendous, tremendous difference, not only for America as a whole, but we will be able to make sure that this prolificates around the world. The United States of America can and should always remain the leader in many areas, but when it comes to healthcare and when it comes to this matter as a whole, I think that this is fine work that we've done, and we always have more work to do, and this is the kind of work that has been going on in both houses. For example, some of what's in this bill is actually shares the same policy goals as Senator Sanders' antibiotic prize bill. So we're talking about a bipartisan, bicameral effort that we hope to see come to fruition as soon as possible, because this is an issue that we as the United States of America can and should be in front of, and I'm very proud of the work that we've been able to do in this bill together. So I yield back to Mr. Shimkus.
And reclaiming our time, I'd like to yield to Congressman Blackburn, who wants to talk on another amendment.
I thank the gentleman for yielding, and I want to thank Ms. Brooks and Ms. Eshoo for the work that they have done. And Ms. Brooks mentioned the Good Samaritan Health Protection Act and getting this in so that we provide some civil liability for these healthcare professionals who want to come in and help when there is a natural or a national disaster. If this first came to light after Katrina, as we desperately sought to get health care into the New Orleans area, and then, of course, after the Boston bombings at the Marathon, it became an issue once again. So I thank them. I look forward to having that included in the final version, and I yield back to the gentleman from Illinois.
And I yield back my time. Thank you, Mr. Chairman.
Chair thanks the gentleman. Gentleman yields back. Other members seeking recognition. For what purposes? Gentleman from North Carolina seek recognition. Gentleman is recognized for 5 minutes.
Thank you again, Mr. Chairman. Mr. Chairman, I'm hopeful that we can include priorities that pertain to children and disasters as we move this legislation forward. I, too, want to thank Representative Eshoo and Representative Brooks for introducing this important bill and for considering improvements for pediatric care in emergencies. As co-chair of the Pediatric Trauma Caucus, along with my good friend, Mr. Hudson, the reauthorization of the Pandemic and All Hazards Preparedness and Advancing Innovation Act is an opportunity to advance health care for children. And so I'm pleased that this bill includes language reauthorizing the HHS National Advisory Committee on Children and Disasters. As we move forward, Mr. Chairman, I hope we can include the same language as the Senate version. Also hope that we can include a provision authorizing the Children's Preparedness Unit at the CDC. Both of these provisions were included in the Senate bill, sections 304 and 305. The language has been thoroughly vetted, and if we could include those provisions in our bill, it would be one less thing to have to tackle during a conference with the Senate. These provisions are critically important to addressing the persistent gaps in our nation's preparedness and response for our most vulnerable children. With each disaster, Mr. Chairman, including the most recent devastating hurricanes, we find inadequate supplies for children, including diapers and infant formula, inadequate drugs and medical devices that are appropriate for children. We face problems transporting children to get their medical care. We continue to face inadequate access to mental health services for children coping with grief and trauma and loss after a disaster. So, Mr. Chairman, I'm going to ask that my colleagues work with us to include these very important provisions prior to it going to the full committee. And I want to absolutely align myself with the comments of Ms. Eshoo, who requested that you work with us between now and the full committee to include the relevant sections in the base text. Thank you for listening. I yield back.
Chair thanks the gentleman. Gentleman yields back. Other members seeking recognition. For what purposes? The gentlelady from Illinois seek recognition.
I move to strike the last word.
Gentlelady is recognized for 5 minutes.
As we consider the Pandemic All Hazards Preparedness Act, PAHPA, we must remember that the workforce is the backbone of disaster preparedness. We must have expert first responders in place to respond to public health emergencies. That's why I am proud to have introduced the HR 5998, the Securing Experts to Control, Understand, and Respond to Emergencies, or the Secure Act, to support and build a robust disaster preparedness workforce. This bill would reauthorize a critical loan repayment program for Epidemic Intelligence Service, that's EIS, offering officers serving at the Centers for Disease Control. The program is crucial to recruiting the very best medical professionals to keep our country safe from biohazards. I'm hopeful that this program can be reauthorized as a part of the underlying bill. EIS officers are health professionals who serve on the front lines of public health emergencies as boots on the ground, quote, disease detectives, unquote, who investigate outbreaks and assist during natural disasters. Since its creation in 1951, the EIS program has trained more than 3,600 officers, including Dr. Stephen Redd, the director of the public health preparedness at the CDC, who testified before our committee on PAHPA reauthorization. Dr. Redd said that he would not have been in the position he is today without the EIS program. These EIS officers are based in state and local public health departments across the country to serve on the front lines of the public health emergencies, protecting Americans and the global community. They deploy more than 200 times each year to respond to public health emergencies at home and abroad. In the past, EIS officers have responded to many major health threats like anthrax, SARS, swine flu, and avian flu, smallpox eradication, and provide disaster relief. 9/11 and Hurricane Harvey and Irma and Maria and Katrina. Mr. Chairman, Ms. Eshoo, and Ms. Brooks, I would like very much to get your help in including this reauthorization in the bill before it goes to the floor. I would also like to add that I am concerned with the inclusion of market entry rewards for pharmaceutical corporations and transferable intellectual property as an incentive for antimicrobial drug development. While I support investment in research and development of antimicrobial products, we must also focus on not overusing the antimicrobials that we have. The overuse and misuse of antimicrobial products in livestock production for disease prevention has caused bacteria to evolve and become resistant. This means more and more bacteria cannot be killed with traditional antimicrobials, making them less effective and humans vulnerable to superbacteria that can kill. As my late friend and champion on this issue for many decades, the late Representative Louise Slaughter pointed out, quote, feeding farm animals antibiotics for disease prevention is like sprinkling them on your children's Cheerios in the morning to keep them from getting sick. It's just unconscionable, end quote. We must safeguard the antibiotics that we have, and overuse in food production cannot be accepted. I thank you and yield back my time.
Chair thanks the gentlelady. Gentlelady yields back. Chair recognizes, for what purpose the gentleman from Florida seek recognition?
Strike the last word.
Gentleman's recognized for 5 minutes.
Thank you very much. I'm prepared to speak on the overall bill, Mr. Chairman. I want to commend my good friend Susan Brooks and also my good friend Anna Eshoo for putting forth this really good legislation. Appreciate it so much. Since Hurricane Andrew made landfall in 1995, Florida's been bracing for the next big one. Each hurricane season and its implications, especially for a state with significant population growth over the last few years, a sizable portion age 55 and older. Last year, America's healthcare system responded to 4 natural disasters: Hurricane Harvey, Irma, Maria, and Nate. From storm-related injuries and illnesses to delivery and logistic issues, last year's historically costly season tested the mettle of our healthcare delivery system. Renowned scientist Louis Pasteur said, and I quote, "Chance favors the prepared mind." As a native Floridian, I appreciate the opportunity to work with my colleagues to improve our nation's preparedness efforts and support our medical community. I look forward to continuing to work with the committee on proactively assessing mission readiness, surge capacity, and other outstanding challenges, lest we suffer a catastrophic, God forbid, failure of our healthcare system when we need it most. So I yield back, Mr. Chairman, and thank you so very much.
Chair thanks the gentleman. Gentleman yields back. Other members seeking recognition. For what purposes the gentleman from Georgia seek recognition?
Thank you, Mr. Chairman. I wanted to speak on the overall bill.
Gentleman's recognized for 5 minutes.
Mr. Chairman, I'm pleased that the committee is moving swiftly on this critical legislation to reauthorize the Pandemic All Hazards Preparedness Act. This legislation reauthorizes key preparedness and response programs that are vital to our national security. I want to thank Representatives Brooke and Eskew for their willingness to work with our office to include a grant program to study healthcare-acquired infections in hospital settings. According to the CDC, on any given day, about 1 in 25 hospital patients has at least one healthcare-associated infection. I applaud the CDC for producing the National and State Healthcare Associate Infectious Progress Report, but I believe there's still more that can be done to develop best practices for preventing HAIs from occurring. I want to thank you, Mr. Chairman, for holding this markup today to ensure that our nation can appropriately respond to public health threats. I thank you, and I yield back.
Chair thanks the gentleman. Gentleman yields back. Other members seeking to be heard on the Brooks amendment. If there's no further discussion, the vote occurs on the amendment. All those in favor signify by saying aye. Aye. All those opposed, no. Ayes appear to have it. The ayes have it. The amendment is agreed to. The question now occurs on forwarding the committee print as amended to the full committee. All those in favor say aye. Aye. All those opposed, no. Ayes have it, and the bill is agreed to without objection. Staff is authorized to make technical and conforming changes to the legislation approved by the subcommittee today. So ordered. Without objection, subcommittee is adjourned.